bang ba tla tla akere ba batlang ba re joina ba tla tla ba re joina. So e re ke le leboya akere ke kopile hore meeting ko mo one ha re batle le tshware di meeting tsa lona akere meeting wa rena ko mo one. So re batla hore le utlwelle rona mo because ha le ka se utlwelle la tshwara di meeting it means le ka se utlwise le hore sa presentiwa mo akere. So ntumelleng ke le leboeng for go fitlheng ga lona mo mosong wa kajeko. Go itumedisa bona setšhaba sa bo rona se kgone ho tsaya ditiro tse tsa parliament. A ke re le biditse ke parliament. Meeting o aswa wa City of Tshwane a se Mayor in Bizo le biditse ke parliament ya lona. A ke re la re bona re emisomo mo pela lona mo re tsentshitse ke lona ka mara parliament a ke re re ba rumiwa ba bo mang ba lona. A ke re la utlwa ya rumile ke lona. So re tlile mo mosong wa kajeko hore lefapha la tsa maphelo le tle le tlo fana ka tlhaloso ya hore mo ngwaga o fetileng ba sebeditse yang ka ditšhelete tse le hore di filwe akere. And then mo pele mo le re tlo le fa monyetla hore le buisane le bona mohlomong le na le dipotso mohlomong le na le dikakanyo tse le nang le tsona. So re tlo le fa sebaka seo mara re batla hore re nne hore mo meeting o mo one a ke re la utlwa bagolo. So e re ke ikitsise ko ntle nna ke nna Ezra Letswalo ka lebitso Ezra Letswalo ke nna modulasetulo wa komiti e shebaneng le tsamaiso ya ditshebeletso ya lefapha lona le la tsa maphelo. A ke re utlwile bagolo ya mara o ka ra le utlwe man or le batla English o la nkutlwa ne a ke tsamaye ke le tee akere ke tsamaya le maloko a mang a committee ya rona re bitsa re ke multi-party committee meaning e na le maloko a mekgatlo e farologaneng. Ho na le ba bo DA, ho na le ba ANC, ho na le ba EFF, ho na le ba MK, ho na le ba PA akere and so on. Ke committee ya rona. Mare ke tlo ba kopa fela hore mo sebakeng se senyane ba emelle fela ba ikitsisa akere le ba itse ke lona le ba tlhophileng a ba itlhopha akere. So e re simolle go re le itse hore ke bo mang batho ba le mo pele le mo lona mme.
Dumelang le right a le nna ke a phela ka lebitso ke Matshidiso Mfikwe ke leloko la committee ya health ke member ya ko legislature le nna ke a leboga chairperson.
Good morning, everyone. Good morning, everyone. My name is Member Louisa Evans. Good morning, everyone. My name is Member Louisa Evans, and I'm a member of this Committee for Health.
Sanibonani igama lami uLindiwe Mkhwanazi ngimember ye-committee legislature.
Dumelang lebitso la ka ke nna Koketso Poho. I'm a member of the provincial legislature serving in the committee for health. Thank you.
Okay. Good morning, everybody. My name is Louisa Evans, and I'm a member of the Health Committee.
Ya le ba bona kere ba bang ba sammane ba le mo tseleng ba tlatla. And then ara fella ka bona fela re na le ba ba re thusang ka mosebetsi o re o etsang re ba bitsa re ke admin support staff akere e re le bona ba ikitsise ka speed ikitsiseng ka speed.
Dumelang bagolo ke nna Maggie Mokonoto researcher ya health committee.
Sanibonani Nondumiso August, the committee coordinator.
Sanbonani Kamala Mungobo, i-service officer ye-committee.
Ya ba bang ba teng le tlo ba bona ba tlo le thusa mme o le ke o le mo le wa bere di headset ba re ke mme Thabisile Nzuku ya mella o re shine. Yeah. Okay, so thank you very much. So ke committee ya rona e. And then mona kong e sa fediseng pelo re tlo introduce le boetapele ba lefapha kere mara ba tlo betsa ba MEC wa rona se tsa fitlhile so re phake for ona byanong. So ke ba tlo le tlhalosetsa fela gore tsamaiso ya rona mo letsatsing la ka joko yo tsamayang akere mara re simolla ko ntlheng ke rile ha re simolla ra re le invite le ke parliament o khotsa yona ntwe le bitsa le re ke Gauteng provincial legislature. And the legislature e bereka ka melao ena le melao e berekang ka yona. So ha re lebile tse yana one of the laws or the rules e governang dikopano tsa rona e re he re tswile re le committee re ile ko mafelong a ko ntle outside of the legislature re tshwanetse re declare bofelo bo as the precinct of the legislature again. So that is in terms of a rule 56 both subsection 1 and subsection 2 again. So we're declaring this place the precinct of the legislature. Era o reng ntwe era o re maitshwaro a rona a tshwanetse a tsamaelane le the way re tsamaisang dikopano tsa rona ha re le ka maradi office tsa legislature a ke re la utlwa bagolo meaning that re bontsha tlhompo ha re buisana a gona modumo re fokotsa movement a ke re ha re reisa dintlha tsa rona re emisa matsogo ra ikitsise gore ke rona bo mang re tswa go kae khanya rona keng a ke re le utlwile bagolo. So that's the first thing. The second thing ke tlhalositse mo gore rona re tswa re le ko parlamenteng ya lona in the province mare se le reng a re sona a re municipality a re tswe from ko municipality a ke re la utlwa bagolo meaning that kopano e ya rona e a se mayoral bizo or a se meeting o biditsweng ke MMC ya municipality or a se meeting wa mo councilor akere so se re tlo se buisa mo ke se se shebaneng le tsa lefapha la tsa maphelo. So dipotso tsa lona ditshitsinyo tsa lona tshwantse di shebisane le lefapha le la tsa maphelo a ke re la utlwa bagolo le ka nna la bua ka ditleliniki la bua ka dipetlele and so on, it's okay. Mara re batlo bua ka street light sa or no go zone 7 street light a di bereke or sewage tseo di tlo tla di tlisa ke boetapele ba municipality bo lefetso bo keng a ke re lefetso go tsenya boetapele bo bontšha ka mara city of Tshwane a ke re le ba bone ya so bao ba tla re tla ba kopa re batle ba tlo buisana le lona ka dikgang tseo mo re na le setšhaba se se tswang mo Garankuwa and beyond. Go na le ba ba tswang ko Soweto, go na le ba ba tswang ko bo Westland, go na le ba ba tswang Sedibeng, go na le ba ba tswang ko bo ya dipleke mafelo a farologana ke re ba golo. So ke ka mokgwa re tlo tsamaisang tiro ya rona ka teng. Ke batlo ikeletsa boikopelo ke invite mo councilor wa leng teng ka kwano ba re ke re Floyd market tema o ra tla tlo re bulla tiro wa rona semmuso because ha re tlile mo lefelong re ikeletsa boikopelo mo makhanselara gore ba nne teng gore re kgone go thusana le bona ba thusane le rona go tsamaisa ditiro tsa rona. Ntate mo khanselara e re ke le fe monyetla o.
Halala setšhaba halala halala nna ka lebitso ke nna Floyd Makete Thema, and ke mo councillor, ward councillor gona mo karolong ya Garankuwa, ward 32. Ne re re, through you chairperson and the committee members who are here, MPLs, setšhaba ka moka go ralala le dipoleke tse le tswang ko tsona Gauteng ka bophara, re le leboge for gracing us with your presence here in Garankuwa. For sure, you should be well known that we've got the second biggest hospital most South Africa, George Mukhari Academic Hospital. And we also have 4 clinics here in Garankuwa, one of the 24-hour clinic. But some of the challenges they have here in terms of the issues of maphelo. So I'm sure there will be a certain time whereby who discuss some of the issues, challenges, solutions that you have, so that you are able to deposit to the MPLs and the members of this committee. However, Chairperson, we want to have pride today that we are honored to have you. Unfortunately, the MEC, Honorable Nomantu, has not arrived yet, but we want you to extend gratitude from councillors of Garankuwa, Baagi ka bophara, re no ra le leboga. In fact, we know it's not the first time and it's not the last time that you come here and see our people in Gauteng, so that in a form of accountability. Accountability. Today is the time when the committee and government is accountable to the people. We know who is their own due diligence and their responsibility as part of the committee to report to you as Baagi, as constituency, about any matter under the sun. Baagi ba feel gore government ga e dire sentle mo yona in terms of issues of health. So rather leboge go tlala seatla, Chairperson, and your committee. Garankuwa is a lovely place, obviously, and I want to recall when President Mandela was here a long time ago, when he would have said Garankuwa is a place of integrity. So people of Garankuwa are very loving, are very welcoming, and want to welcome you, including the committee and the people of Gauteng. Thank you very much.
Re lebohile o menane mokhanselara wa rona for mantswe a mantlo a re fileng ona a etsang gore le rona re no fale a re le ka mara nna ke tswa ka mo wa ke pleke ke itse thata, so I'm not a stranger mo bofelong ba ba ka kwano ke itse le dikgwetlo tsa teng a ke re ba gone, so a ra latlhe a re le ka mo ke ba tlo invite re ba re ke re senoto teane mo nakong yane khutshwane fela e tlang tate a ke re ke a itse gore motlhomong le na le ditletlebo di tseneletse tse le gore ga di a shebana le tsa lefapha la tsa maphelo. Re o ke mo kopang gore a tle mo pele a rona ba re ke ntate senoto teane ke committee petitions support personnel ko legislature ba shebane le komite ba bitsang mare ke petitions, meaning gore ha ona le ditletlebo motlhomong mabona bereke mo strateng so tswang go sona, motlhomong municipality e sentse dilo tsao di rates e di tlhatlositse go dimo mara hona tlhaloso re o kena so ke batlo re a tle fela tlo le fa process an le yona ga re wa tshaba bana ya mara hantsa tla so a ke re la bona go morao ha lona mo lona le mabokisi a mantshwala a ke re la bona mabokisi a le ke di interpretation booth or translation, translation, because we interpret that something different. Mabokisa le ka o translate, meaning ba ile re motlhomong a ba utlwi puo re buang e o kgona fiwa di gadget le tlo di bona di gadget tse di tshwana letse a ke le tlo emisa matsogo ba ile re motlhomong motho a utlwi English or a utlwi Setswana ba tlo lefa tsona, and then di na le di-channel tse di farologaneng akere wa ba tlo utlwang tsamaiso ya rona ka Senyesemane ka English o tlo tsena mo channel 1, wa ba tlo utlwang ka Setswana Sepedi o tlo tsena mo channel 4, wa ba tlo utlwang ka Zulu Sindebele channel 2, wa ba tlo utlwang ka Afrikaans channel 5, wa ba tlo utlwang ka Sevenda Tsonga channel 3, and then ba ba nang le tlhoko ya sign language o kae mmele ntate ba sign language ba kae ba go kae ba go morago akere so ba ba nang le tlhoko ya sign language le tla itshupentsha le mme gore ke ntata ke bone mo so ke bo mang ba ba tlo tlhokang tshebeletso eo ba emise fela matsogo and ka se itu fela ba tlo tlisa tsona akere ba tlo le tlisa dilo tse ke dilo tsa ke asset ya legislature di na le di-tracker kore ha o re wa tswa ya toilet o e tloela fela mo stulong e na le tracker akere o tlo kry-a banong ha o ka itebala wa tsamaya ka yona ba o latelela ko lapeng wa tshwara minimum sentences ya rona o tsamaile ka selo sa state akere la itse gore ke 7 years maximum ya teng e tseneletse thata so ne ke re fela ke le thuso gore le ska kry-a le gore motlhomong o tswile ka tshoganyetso bo e lebala o tsamaya ka yona akere so ke ya matsogo akere tla thusana le lona ba lefe tsona ba kae bontate le bomme a ko re letseng ka bonako and then e re ke kope ntate Tshwane a re fe overview ya di-petitions gore di bereka yane ntate Tshwane sebaka ke sa hao.
Dumelang bagaetsho le kae modula stulo o kopile gore le ire fela yalo ka situ ha ntse re tswella ka tirelo ya rona ke leboge modula stulo maloko a committee le mo councilor rona councilor Tema badudi ba Garankuwa ke sa lebale le office ya MEC
ba holo re rile re kopa re etseng ka situ akere dilo tse o emisa fela letsogo a re bue re emisa fela letsogo akere emisa fela matsogo and then matla thusana le lona
ke a leboga modula stulo ka leina ke Senoto Tshwane ke a itse ga leina le Senoto ke leina le tswang from Senate le tla gakologela gore Senate ke ga go kopane go buiwa go tsewa ditshwetso tse di rileng sa re kopane re le yana re mo senotong leina la me le ka ya fela yalo ke tswa ko Gauteng legislature mo uniting e re bitsang gore ke public participation and petitions unit ke tswa mo kantorong ya petition sub unit le rona re supportang committee ya petition standing committee ke tla le kaela gore pharologano ke in between portfolio committee le standing committee before re tsanela go di petitioning so that le kgone go bona pharologano e leng teng gantsi ga re bua ka presentation ya di petition bagolo gore le tlhaloganye pila re covera di item tse le di bonang tseo fela ke ilo tsenela thata ke batla fela le tlhaloganye ka bokopana gore ga re bua ka dingongorego e leng yana petition re bua ka eng so gantsi re tlhalosa di-terminology tseo le gore re kry-a kae mandate wa rona matla a re a kry-ang ra kry-a a tswa a le ko kae re bua ka constitutional mandates be re tsenelela gape re bua ka environment ya di-petition gore re tsamaisa yang dingongorego tsa lona ga le di tlisitse ko Gauteng legislature re bua gape ka yona molao wa rona wa di-petitions ga re bereke fela go na le molao o re tsamaisang o retelelang ko pele gore tshwanetse re tsamaise yang dingongorego tsa lona re bitsa gore ke Petitions Act number 5 of 2002 o ga yana re le mo tseleng ya go fetola a re bua ka amendment bill molao ka kwangwa o change molao o ke buang ka ona gona yaanong Re bua gape ka gore ke eng se re se kayang as a complaint, a valid complaint, ke eng se leng gore ha re kitla re se tsaya as a complaint re legislature re lebeletse fela ya the separation of powers. Hona ilo tse leng gore re khona re tsenela mo tsona, hona le maloko kapa di theo tse di rileng tsa puso tse leng gore di tshwanetse di tsenelle mo mathateng a lona. Matla a komiti ya rona a nang le yona, including the power to subpoena. So re khona so subpoena lefapha kapa masepala ha o tliseng ngora ha o ha ile gore ko mafellong ha ba tlisi pegelo eo a report gore ba tla go thusa yang. So contrary ha re bua ka petition ba golo re ba re lebeletse ntlhakgolo e ba reng ke public participation. So petition is a means, it's a vehicle e khonang gore le khone go tisa dingongorego tsa lona ebile le tse karolo gape re bua ka public participation le tsa karolo mo ditshwetsong tse ileng gore di a tseiwa kwa legislature. Go pela gore legislature e dira melao ebile e tsaya di-decision tse le affectang maphelo a lona a ka letsatsi le letsatsi. Ska le tlile gompieno yana le tlile go tshwaela mo pegelong e tlebeng e fiwa ke lefapha la maphelo le boitekanelo. A kere le bone gore a ntse ba tsamaisa matlotlo a ba abetsweng ka tsela e tshwanetseng le gore dithebolelo services tse e leng gore le tshwanetse le di kry-e a di a diragala na le tlatla le tshwaela le fane ka maikutlo a lona gore lefapha leno le a dira kapa ga le diri na. So le na le karolo eo ya gore eng tshwanetse le tle le tlo tsaya karolo le tshwaele ebile le gape le thuse le legislature go dira di-decision tse e leng gore di maleba. Okay, so petition ke eng bagolo? Petition ha se sepe fela lo ntlo gore ke tokomane, a document e leng gore e tlebe e ngwadilwe e kopa a request, e dira a request e kopa gore government kapa yona legislature e le direle 1 2 3. Akere so e tlebe e saidilwe tokomane eo e be e tlisiwa. So fela act ya rona e tlhalosa petition gore it's a complaint or a request or a submission or a representation addressed to the legislature or the committee of the legislature. E dira kopo eo e rileng. Re tla re lebella gore dikopo tseo ke tse di feng tse e leng gore committee ya rona e kgona go lebanana le tsona. Tse ding ke a di tlola. So legislature e dira yana ba gaetso re dira melao ya province, melao e leng gore e affecta fela province ya rona ya Gauteng, including lona molao re fetsa go bua ka ona wa Petitions Act number 5 of 2002. So ra bua gape re di amendment ra fetola melao eo ka nako nngwe ra bua gape ra itlosa re bua ka repeal of the act ra itlosa as every decision making and legislative processes tse di dirang. Akere se sengwe gape ba dira ntho ba bitsa ke oversight and scrutiny. So le tlile masepala le bone ba na le dikomiti tsa bona tse di lebaneng le mafapha a masepala, gape na le dikomiti tse e leng gore di tsamaisa ntho e re leng ke governance system ya masepala. So re tsaya ka matla rona le re dirile kopo go TMPD akere ya gore re kopa go matcha nne ba tla le fato ka eo. Section 115, section 118 yone buang ka public participation. Section 195, we have evidence, and that you must be afforded an opportunity to be given a written response within reasonable time. Makala ao a constitution ya rona, e leng ngwana molaotheo wa rona. E fa Gauteng legislature matla a gore ba dire se re bitsang gore ke molao o tsamaisanang le ka moo o tshwanetse di-petition kapa dingongorego tsa lona di amogelwe di be di processiwa go fitlhela go tharabollo. So e bo go nna le ntho e re bitsang gore ke Petitions Act number 5 of 2002, pele in the early Petitions Act, 1998. Ebe fetolwa in Act number 5 of 2002. Haya nagi kaile ka remo rnale service bizangwa ke Gauteng Petitions Bill, Amendment Bill. Elong hore hana ya no re tsamarira the public hearing. Let's tshwaela gore o wa kantsweng o fetolwa. O ama yang kapa dumelana lona kapa nya. So se simolotse beke fitile ne re le ko Pimville go ethu. La boner tleberele ko Sidibeng. And then hape na le petitions regulations tse di tsamaisang gore o tshwanetse o submit your petition on a prescribed format. Ke re bua ka a form, petition form. E leng gore ko mafelong tshwanetse o e sign bo be data o sa e signa ha re itse. Ba tle go e reject. And hape re na le standing rules tse di tsamaisang di kopano tsa di committee modulasetulo o buile ka gore o declare this place as a precinct of the legislature fela ya. So in a nutshell, molao wa rona o re nang le ona gona yana wa act ya Petitions Act ke gore fela o lefe ditokelo tseo from constitution ere o na le right ya go ira a go submit a petition, to picket, to demonstrate le go marcha fela yalo. So act ya rona e go fa matla ao in detail to say yes, you can petition us as the legislature. Fela re tla re lebella gore petition ga go iragala eng. So ha re soboloka ra re if it relates to service delivery ditirelo kapa policy molawana o rileng wa government ya rona o ka nna wa petition service delivery and policy of government o ka nna petitioner because gona le motho e leng gore o tlo khona go go araba kere. Unlike how o tla mo rona o re mabane ke lwele le mosadi o ntrapile gut nna re ka se khone o tsereganya wa haitso re le legislature re ka se khone o tsenella o tshwanetse o ye kae o tshwanetse o ye kae ke batla o check re le itse ditokelo tsa lona o tshwanetse o ye kae wa o trapile gut mabane ha le itse police station o ka nna feletsa buila leng restraining order kere or la feletsa lile ko family court. So high wela mo tlase ga legislative authority re bua ka Gauteng provincial legislature. High wela ka fa tlase ga executive authority re bua ka bo MEC premier fela ya. High wela ka mo tlase ga MEC o rileng ka gongwe MEC wa health me Ralogoko o tlile a le tshepisa XYZ. Selo se e be se sa diragale ona le tokelo gore o lokele ngongoro ya gore se le re tshepiswa XYZ ke MEC fela se se iragale re batla go itse gore go iragala eng. So ha itsamaisana le se MEC o rileng o kileng a fiwa marapo wa gore a tle a buisane le lona ba le tshepisa o khona ro petition o tla arabela. Ya bofelo ga itsamaisana le provincial supervision of local government ke tsona di masepala tsa rona tse di province ya Gauteng ha o kitla o complaina ka Gartsibande municipality ko Mpumalanga o le mo Gauteng ha re khone gore re tsere hanye re tshele botara kere. So legislature GPG MEC o rile mo province kapa masepala o khona gore o ngongorege ga ile gore o na le ngongorege eo e le baneng tsona makala a le mane ao akere act ya rona tswela pele ka gore ga e le gore ga e wele mo tseo committee ya rona ya petition standing committee ga ya tshwanna go tsena ka gongwe re isa dilo tsa labor issues re e bankobile go mmereko gona le go tshwantse go teng ka re bo CCMA labor court and so forth akere. Two, it's a matter pending in a court of law. Re bua ka separation of powers. Re dira melao re le legislature. The executive implements those laws. The judiciary, on the other hand, the judiciary must then interpret whether you have transgressed the law or not, based on evidence presented. Again. So, high law, it's a bit or legislation na ke ile ka sentence wa ke kopa gore le fetole sentencing ya ka kapa judgment eo ha re khone ba gaetso because ha re kgone go tsenella ko tse di dirwang ke ba bangwe, including yona judiciary. If ile a matter e leng gore ile ya go a commission of inquiry, le yona ba gaetso tshwana le the tax inquiry, se bitsa gore ke tax inquiry into violence mo tax associations tsa rona, le yona ba gaetso le ha re kgone go tsenella. So le ha o ka gapeletsa go e tsenya ba tlile go e rejecta because molao wa rona wa re guide gore tshwanetse le tse di latelang ha la tshwanno di tseya fela yalo, including gape le go ka ya go public protector ba gaetso bo o tla gape because ha wa thaba ka disine tse reng go ha re ke tla re tsenella. So re receive every petition e leng gore e tsamaisana le ka mokgwa molao wa rona o buang ka teng, and then re tla be re go nela an acknowledgement letter ya go bontsha gore re e kry-ile. Go tloeng foo re isa ko committee ya itse ya sekaseka ba lebella gore mabaka a o a fileng a straightforward kapa go na le mo tshwanetse o tlaleletse, ha le o na le mo tshwanetse o tlaleletse ke boela gape go rona ra go e tla o tlaleletse. Ha ba itse ba adoptile ra e tsaya re isa ko mafapheng, e ka ba health, e ka ba transport, depending on raise the issue tse feng le ona masepala, and then re ba fa nako e lekanang le 20 working days. 20 working days, re bua ka Monday to Friday times 4 ke 20 days ke kgwedi e yotlhe. Ha reporto e sa tle ba holo re a ba reminder re ba fa gape 10 working days, so re bo kae re bo 6 weeks yaanong ke nako e re filang gore enough gore ngongoro ya gago tshwanetse be le gore e rarabolotse kapa re kry-ile bonnyane re kry-ile report. Yaanong ha e le report ga e tle kapa ha o utlwane le se se leng mo reportong, re feletsa re ya kontho e re bitsang gore ke petitions hearing. Committee tle be dutse fao le wena o tle be invite-ilwe go tlo ipuella, department le wena tle be le teng, committee ya tseregana yaanong ya facilitator engagement, so le a buisana. So ka mantswe a mang committee eo ya petitions standing committee e le bulela menyako e leng gore gantsi ga le ya le kry-a le gore e tswalegile akere. So tseo ke di-functions tse committee tshwanetse di direng on a quarterly basis, tshwanetse le ba dire reporto e ya go what we call the house. The house ke yaanong ke maloko a otlhe a kopane, including le ba servant committee tse ding ba le ko plenary, speaker e le ena a facilitating session yaanong, chairperson ya committee o tla be a fana ka pegelo in the house, and then ha ba adopta e tla be e bontsha gore ba berekile for kota eo. Ko mafelong ha re o kgotsofetse ka nako nngwe ha o submita ngongorego ha e se gore o tla o kry-a o se batlang. A ka re gape government ba gaetso dira ka di-resources ka matlole, the fiscus e nnyane compared to the needs tsa rona. Kung ba tla ba re no ha re na ona matlole gone yaanong, in the next financial year ke gona re tla lebellang gore ka kgona go dira se setšhaba se se kopang. So at the end re tlo tshwanela no re tswalle committee tla tsaya decision ya gore ba e tswalla petition re bua ka closure of the petition. Ha e le gore still ha wa itumella tsamaiso eo, on a le right to appeal. Appeal eo ha e tle ko committee ebile ha e tle ko rona, e tlo ya to the speaker's office. Re avoid the issue ya a referee and a player at the same time, because re ka nna ra ba biased gape ka mokgwa wena me bo itsang ka teng gore ba ha ba ilong treata gape sentle. So ke batla go ya ko mafelelong o ka re kry-a mo dinomorong tseo kapa yona email eo. Ha o tlhoke o tloge mo region o le mo yona ka Ekurhuleni, Sedibeng, Western ba Joburg ba gaufi, because re go Johannesburg City Hall. Ha o tlhoke gore o tloge gape o le mo Tshwane e bo re o tla kwa wa re leletsa ra njalo wena gore ra tla kapa if una le di means, technological means, una le bokgoni bo ba go romela di WhatsApp, kapa o romela tsona di email, o ka nna re romela email kapa WhatsApp, mo di nomorong tsona tseo, o romele ngongore ya gago, kana o buele rona re go tlhalosetse sentle gore so complainang ka sona, sa qualify as a petition, kapa ha se qualify. Go tlogeng fano ba gaetsho tlebe ke le ko morago ko ne le signa registera teng, bao ba batlang tlhaloso e tseneletseng kapa ba na le dingongorego ba tlang kry-a gone kwa ko morago. Ke a leboga.
Ya re mo pele magofi bagolo. O le empowering politicians system. O re ntshwele ya roto itoya mo dikhoneng ra fisa mataere. A re tlweleng system e ke. And one of the things e le gore maybe motlhomong o lebetse o bua gore committee ena le matla e kgono sa phina MEC e kgono sa phina premier e kgono bitsa mayor o ra tlo fana ka tlhaloso gore why ditlhoko tsa lona di sa shebisisiwa ke re la utlwa so ra ikopela mo lona re tswetswe ha ile re lena le mathata le itemogelang ona a shebaneng le tsamaiso ya mafapha a golomente tsenyang di-petition tseo a ke re le utlwile bagolo so ra lebogang tate teana a ke re o file di-number mara o tla bantsa le teng a ke re o tla bantsa le teng ha ile gore motlhomong ona le gore ga o utlwa sentle le tla ikopantsha le ena re reo a ke re so mo nakong ya ona no re tlo tsona mo lenaneong la rona le le re tlisitseng mo mokhuduthamaga wa rona wa tsa maphelo o kgonne o fitlha a ke re ena ka lebitso ba re ke mme Nomantu Nkomora Lehoko mo program wa kwetse no ba kofi bagolo o re kgonne o fitlha ya o fitlha mo because o tlo buisana le lona ona le kgono interacta le ena ke re on all of the issues that you might have mara a tsamaya le one e re ke mo fe monyetla a kgone le dumedisa sentle and then MEC you will also introduce those that are accompanying you today.
Sanbonani, dumelang, nekai, yaphila. Igama lami ndinguNomantu Nkomora Lehoko, ndiriporta kubaba kunye nekomiti yakhe le enibonayo eParlamente. So abantu ke ngoku andihamba nabo, ndihamba kunye ne-HOD, umise bakubone, uDr. Selepe, ndibamba kunye nobaba oyi-DDG, ugama lakhe so i-unit yethu ibikhona in-infrastructure but ibifile. So sivusile ke ngoku sinala baba ongu-DDG we-infrastructure osebenzisana nathi kwi-department. Mfutshane bathi abawuboni. Phakama ume ukhwele esitulweni ngoba umfutshane. Igama lakhe nguXolisani Galada. Kuphinde kube no-DDG. Igama lakhe nguBesani Baloyi, ngiyena ngowe-corporate, nguyo oqashayo abantu phaa kwi-department. Xa thi umntu andikaholi nibuze kuBesani, ningabuzi kuthi namhlanje, sathi makaphakama aphendule. Emva kwakhe kulandela u-CFO. Uthanda ezi ndaba masizicacisa uJack azisemaphepheni kodwa sihlala simnika xa isephepheni ayitwiste che ingabi lebe siyithethile. Kuno DDG phayana uba kuphakame emva kwakhe kuze uNgwepe chief director Ngwepe phakama kwi-planning. When we strategize, we plan izinto enizawuziraise kule meeting. Ungwepe yena umsebenzi wakhe ku-pick up all those things asimplifyele zona athi ukuthi le mama sithe siyayenza asikayenzile. Uyasi-evaluate every week Ungwepe on Monday ebusuku sixelele uba sindawoni ngokomsebenzi wethu. Eceleni kwakhe kuhlezi omunye ubhuti onesuti ndizizikwaza suti zakhe namhlanje. Eza suti zakhe zithe nca emzimbeni. CIO ngu-Apleni Anele igama lakhe. Bathi babembiza ngu-AA. So ndithi ayi AA le nto enyangwa abantu nabanqwakazi sawuqala ngaye masinyanga. Ecankwakhe ngu-Chief of Staff in the Office of the MEC. Umane sithi deputy MEC mayizintroduce ndingekho ebantwini. Urhawukhelo Malisa. Ecankwakhe ngu-PLO. Phakama Peter uyaziwa wena futhi kule ndawo. uPeter unomkhukhu somewhere uPeter. PLO yethu olayeza between us no chair ne committee kunye nathi ne office. Emva kwakhe kukhona untombazana, phakama ntombazana bakubone, igqwetha lethu uAyan Mazbuphina, one of the youngest lawyers. Chair litigation yehlile in the department. It's because of that girl and ayabonga by two. By a mediator, masifika ngo 2022 scale sethu sasiphezulu siko 30 billion. Manje we are down, we are paying now, it's 9 billion. That is there now, that has been audited. So siyehla futhi ndithe ndifuna xa bephinda bezopresent umalotane kunye nami nabantwana bakhe babe sithi now siku 3 billion but nayo andiyifuni. We want completely eradicate that money esibhadala abantu because of litigations, but basebenza no baba Mankopane no baba Slepe to ensure that esibhedlele akunazi incidents ezenzekayo. And I'm happy this side we don't have many incidents eTshwane. Ntate Makutu aphakama before siya ku chief director urefilwe phakama chief director wethu we health promotion programs pa singu number 1 chess wa green. Ningaya ku AG nibone, that's the unit esivusileyo yethu that we are green in terms of the work that we are doing to community. We follow people. Umuntu oye akazikipilisi zethu refilwe ahamba ne team ayomkhangela simfumane. We are doing everything that we can. That's the best performing unit now that has been audited by the AG on the finances and on the projects that we are doing. Teach programs ziranwa nguye. You find us in the hostels. Uhlezi nalamfano secanga kwakhe wevenda naye phakama mfane venda wami. Yena responsible for diabetes. Amaxhegwazana zonke izinto xa senze celebrations ze diabetic month namanje yeza umcimbi wethu omkhulu si integrate namanye ama provinces che. We did it with the Northwest. This one sizawuyenza now uzabukhona because ngaba lapho urifulu uzalwa la kule area ngwalapha eGarankuwa. So they want us to do it somewhere here. Sibenkhalaza ukuthi wayingayi go Eastern Cape kwi border Eastern Cape, but bathi kukude bafuna border is closer because we work with Limpopo and this one we worked last in the Northwest. We are going to work with Free State because some of the people that are coming in your hospitals here are coming from Northwest, and I think that's the emphasis here about that they were saying to me to convince me. Ntate Makutu, if you can stand up with the team that side before this just Gatata. Ntate Makutu with the team is the acting chief director now yalapha eTshwane on the because chief director simthathile ubaba uPitsi. Ntate Pitsi sayosinceda enational so sishiyo baba Makutu with the team. Any issue responsibly esibhedlele ne clinic Ntate Makutu is there. I wanted to tell you something that I know you saw it thethwa ngayo kunomama owashonayo mama uGloria. The team Yamiala have already started what Cubans are doing. Besides, not only here anyway, all the province that is led by Refilwe, we go and visit families with the doctors. What Cubans are doing, we're doing it already, Tinanatila. And Ntate Makutu is doing that. If you are not doctor, you check kaya, then you treat. So already that program is starting. We are still limping, but we have mobile clinics that HOT has bought. Is 16 now. Refuel. We are going to launch them. Each community is of a mobile clinic here. But our aim is that in the next 2 years, in every ward, it's not doctor that is assigned with nurses. Because already says it's a program leo good. As if you check the clinics, if you check the zindlin, if you no go kulayola. So tumelo doctor ngok baye noma kuthi bayomcheck up akoyo simse clinic ise simcheke ekaya. That's what that team hence AG give us green in terms of that because they went and see the work that we are doing in those communities of preventing now because we don't want people to go to hospitals. We want to prevent all these diseases. Che. That's the team che siphethe ininzi yona, but every one of them unomsebenzi wakawenzayo that makes that service the citizens that wants us to change the scenario about the health chair. I wanted to dictionary practice. Thank you, Chair. But thanks, Chair, so much and the support that you have been giving us as a committee. You may think that in you are helping us to do our work. So anything that you find in the community, so that you must do it. Nina, you are the link between these communities and us. So where you see that we are not servicing, We are open to your call, Chair. Thank you.
Thank you very much, MEC, for respecting the residents of Gauteng. So the MEC did not come by herself, but she brought the entire management and leadership contingent of the department so that they can give a proper responses to potential questions that you will have. And this is what we must appreciate. Without wasting other time, I think the MEC has already explained that the department accounts to the committee across all their performance indicators. And that is why the committee would have resolved that let's go on the ground to engage with the residents of Gauteng. So as you are here, you represent the broader cohort of the residents of Gauteng. And we really hope that you will follow in the presentations that will be made and that you will engage robustly in what will have been presented to you. So without wasting any further time, MEC, I'm going to hand over to yourselves so that you can take us through the presentation. I've noted that it's a long presentation. We just got about 68 slides. We are going to request that in the interest of enabling greater focus and concentration, we speak to the more salient, the most important points of the presentation so that more time is spent on allowing the residents to engage with the department. But we must also duly apologize because of the volume of the presentation, we could not do printouts. Because you can imagine when you don't know the numbers of people who are going to be in the meeting, and then you take just one presentation with 68 slides, it would have been quite a lot. But what we have done, we have put up screens across the wall. So we want to urge you to follow through those screens. Mara for bonkgono le bomkhulu ba ba leng teng, re kopile hore they must be prioritized and be given the minimal number of printouts that are there. For bokoko akere, le bontate mogolo akere. And then the rest of us re tlo kopa hore le di shebe mo di screening. And then we'll take it from there. Where you have not seen something, just note it down so that during question time you can also draw us back to what you might have missed and we'll go back to it. But my last plea is that as the presentations are being presented, let's minimize a noise. Let's concentrate so that we record all the issues that are presented. Yeah, so maybe let me hand over to the department and then we'll run us through. Yeah, so apparently you have been given folders. So if you have got anything that you might want to note, you can use those folders to note. Again. So thank you very much, MEC. I'm not sure whether you might prefer to use that mic or this. That one is easy because you don't have to lift it up.
Thank you, Chair. Chair, without wasting any time, I'm going to ask the HOD just to run through the presentation without compromising the content, Chair, of what you expect us to do. I will hand over to him to start now running with it.
Right. Thanks, MEC, committee, Modula Stulo, Labor Duty, Gauteng, including Garankuwa. Chair, I hope I'm audible. I'll run us through the presentation. The chair will later, or the presentation is a bit long. Mara, I will do the first 24 slides only because the gist of the report and the facts that the community would want to know are one. Thanks, Chair. Like ke ne ke setse ke boletse hore report ke etelle ha fela ke tla cover the first 24 slides because ke most of the performance indicators that department dealing, and we will spend some time re di unpack re tsa hore re di simplify hore o kgone ho bonala. Report here report representing today ki annual report ya the 2023-24 financial year fedileng, and the MEC will have said at a high level reperformile jwang ko certain areas. Some of the things that the MEC will have said are actual to date. So the report will have ended up to 31st of March, but the MEC in her comments and remarks will have then said what will happen even beyond the annual report and where we were as a department. So, re tla thoma ka ho bontsha just the abbreviations ke mantswe a sekgowa a leng mo reporting mo as a reference in case o na le di abbreviations tse dintsi mo reporting tse di sa tlhaloganyeng. We always prefer doing these abbreviations hore batho ba kgone ho boela morao ba kwishishe some of the medical terminologies that the report covers. As an introduction le summary, report here representing it under review when MEC le premier ba leading department. Mostly the new issues that will be in the report ki taba ya who introduce taba ya TISH. I think remember was introduced. Township informal settlements and hostels. Most of the work that we're reporting will have been some of the work we'll have done in that area. We had a strategic reflection in terms of the work at the department. We also did some work, including most importantly, ho fetsa le ho bula di clinic tse ne di planilwe that were open. Some of the clinics tse di butsweng ka that are here under review. Ke Fine Town Clinic, Sebokeng Zone 17, CAC, Philip Moyo, le tse dingwe. Overall, the report here we presenting today, compared to a prior year, the department overall performance, all the indicators will have then increased percentage by 3%, moving from 54 to 57%. Overall, all the other indicators. Most importantly, as CFO was introduced, that we were able to spend 98.1% of our budget. The work, the allocation that we're given. For that slide, I'll explain where the underspending was and why. Generally, we are also trying to warn over the years, over the 5 years, the department has been on a trajectory of improver. Here we comparable red, liver green colors, year on year since 2019 to the year under review 2024. We're moving from 35.2% that year, and then of course finishing 57% year on year overall. That's one of the messages we want to say. However, when the areas, the programs had performer according to plan, and some of them include areas like district health services because of other areas that are later. And in district health services, in the indicators, any other program, as you'll appreciate, the Betlele, maternal child health programs, Gauteng, HIV/AIDS work, issues about health promotion, and all those indicators, they fall under so. So you look at the basket of the indicators, most of those indicators are. Use this slide to try and simplify the work that we are saying to do. More in Rebonsa, the targets that we're able to achieve, and the areas that will highlight and go our area, mother and child, especially the transmission rate, that area of work where there was improved, and we of course will have met the national indicator. So this is kids that will have been born and after 6 months, for mothers that will have been positive, they still do not test positive, and that's an area, of course, we are working towards a HIV generation free, and that's one of the indicators. CCDMD chair is a program, a chronic distribution of medication. Ke program e encouraging badudi le baagi ba mo Gauteng hore instead of badutiang medication, ba le stable, ba le compliant. How to hore every 30 days, every month, by a clinic in Balata Mziki. If we enroll on that program, the doctors can give you a prescription 6 months. So every 6 months only, you'll go back just to get a baseline. Medication or how other delivery would nearest to arrangement depending how you don't have to go to the clinic. Only controlled blood pressure or hypertension, only controlled diabetes or and those conditions, as long as all is stable and all compliant, we can create Miriana how for 6 months and stay away from the clinic without going every month. HIV/AIDS in terms of the program there, and Erebua check at 95 as a province. Ho testa batho mo Gauteng ha re sokole. Wherever we go, le re ka montle, le re ka ko di clinicing, with the partners, ho testa batho is not one of the biggest areas. The problem ke hore batho ba testile ba tseba di results, ba hantshi ha ba wowe who initiate a treatment, hore ba thomile treatment aba continue ka yona. Ke mo re sokolang, and ke mo re khopela hore re berekisane le setjhaba on that area. Ho testa se bothata, mara o beya batho mo treatmenting low comply. And re a tseba also hore Gauteng, it's a highly mobile provinces. Batho ba kana ba tlile mo ka mmereko, ba tlile ba testa, maybe ka nako ya secondary treatment aba sa dula mo Gauteng. Those are some of the issues that nahana hore they contribute. Visit that area we're also encouraging it, and this is about remember ba leba imileng ba khona ya clinicing who test early if ngwana ho la habotse and if there are any other potential complications. As far as the other issue, your training, we're not being able to enroll over 2,200 student nurses and emergency care practitioners, about 79. Some of them are more down the road, most for that type of training. Medical legal, they know that currently it's even lower than that. Patient satisfaction survey, but most of the time, by happy. And we are not saying any other challenges, but he'll collect all other complaints to the compare relative to the number of visits. Patients are satisfied with the services that we inherit the assessment that's on. Oh, sorry. Non-communicable diseases, I think that's another thing. The screening of diabetes, hypertension, and all those other, including HP1, we are continue to do that work, and we're improving that. The targets there we are meeting, in fact, are exceeding. The ideal clinic hospitals, they were assessed, 37 of them, so 25 of them would have been found. 67.5 hospitals have met the ideal clinic status, and that is really the work we want to. So the summary is something in terms of mother postnatal visit, only increase smaller, the issues about vitamin A, the issue about specialized hospitals and the challenges there. The issue the patient incidences, some of them are not resolved as quickly as possible, and that's the area we are reflecting in that area of work. Mara, over and above that, we've been able to increase and including additional mental health care beds in the area under review, over and above some of the things. We are also saying we must be honest with the community. Only the areas that we might not have ideally performed. And in the annual report, we are demonstrating that as far as the issues Tshwane, availability of hospital boards, there were other boards that will have been resignations. The issue at the hospital boards, like any other thing, you can't have half a board. If Motomi one resign, that board is not fully constituted. And those are things that affect the constitution of the functioning of the boards. The issues about administration, we are saying there were challenges in the areas of township spend. Some of the things that it's something that as a department we are aware of, but we are also putting strategies, including partnering with the business forum in areas where it's about some commodities, especially easy day-to-day commodities. We should be able to get them go to township and township businesses. Medicines availability it decreases at 1.2% in the area under review. And Chair, maybe to explain when pharmaceuticals banalize any area of active ingredient supplies, then they are not able to supply because we don't manufacture medication, we buy. So when the supplier does not have, all of us don't have. And this happened in the area under review. And because they are transversal contract, they affect the renaka of fella, but the medications that we the contract. Here to report. There are areas strategies to come. The areas that now perform. We are demonstrating since then and in the current 3 quarters of the financial year rates are in order to improve the target areas. More as far as administration, the issue of the invoices, supplier processing, issue of GRV, here in Alichalete, we are able to then process and pay in time. There are issues of OHS compliance. Dr. Snabe, who is not here, has then demonstrated a report. And since that report was presented, or this, in the past 2 quarters, there are areas of our facility that have improved up to 85 to 95% in this area of compliance. And Morris are complying, really, Chair, it's about structural challenges where either the design or the age of the building is irrelevant. As far as ICT, we've been able to launch the queue management, but also we've been able to roll out the SEP and the PECS. PECS picture archiving, doctor for X-ray, to be able to have that picture even for future purposes, even other facilities can share and access your records. More programming HAST, one of the areas where most of the indicators we've been able to work on the issue about viral load suppression, and this, of course, including the issue about public education, literacy to improve and include working law improvement guidelines. The issue about TB, the issue loss to follow up, we've put mechanisms in place to be able to trace patients that will have been including the MDR and XDR patient. Maternal, child, women's health and nutrition, improve a couple-year protection. The issues about the live birth under 2,500 grams, and including that training in that area, the obstetrician and midwives to ensure that practice the latest guidelines and protocol as far as that work is concerned. Here the same programs that really are performer. As far as EMS, and I think it's important, we also, Chair, we said we raised this issue, that there has been a serious attack by the ambulances, the committee in and this has affected how EMS personnel respond to the emergencies. And Chair, if we're going to get to an area where ambulances must be escorted, we are going to lose lots of lives because emergency personnel feel unsafe. Because police are enough for every ambulance that must go. But we also know for in emergency, time is an issue. So we must, as the community, work on protecting these assets so that ambulance but last time Mamangodi Digo Mabopani was shot dead for a cell phone, but Mabopani but reluctant to go service calls. That's a really a true story, Chair, of type of incidences and how it affects. Program 8 in terms of the health facility, I think in the medication, when we are performing well as far as distribution of medication and availability, where the suppliers, we are able to get out of the contracts and go find it anywhere else we can, so to ensure medication is available. Chair, the implication here that we then buy medication at prime. So if ka contract re kgonne o e reka ka 10 rand a Panado, if motho a na le contract ya Panado a sena yona, re lo e reka ka 40 rand because o na le yona we tlhoka no and we need it. As an example, Chair. Infrastructure, I think, increase the delivery infrastructure, including sorting out the contractor issues like Kokutsong, Lemaiboye. Summary performance, Chair, in this area I just presented. There are areas where performance year on year did not decline, it remains steady, and that is an area 24-hour clinics, Chair. Chair, the issue at 24-hour clinics, we already have 38, our target is 40. The difficulty is the getting the 2 clinics I referred in the previous slide, coming on board and then providing those services. So there's a direct relationship, the delivery of the infrastructure and of course expanding the services. That's the direct implication, Chair. The issues that now improve issue about district health services and tertiary health services. Hey patient incident severe or complication, we must be able to close that issue with the complainant as quickly as possible, within 30 days as prescribed. Sometimes goes through the investigation, others, it overlaps, and that's what the report reflects. I will not deal with each and every area, but it's safe to say that I will have spoken to some of these issues. The other area, the issue of malaria, red fatality, we're being able to reduce that. We are not a malaria endemic provinces, but we still find odd cases, some malaria patients in our province. In terms of the summary of performance, I'll step off that and get into the other area, and it will be brief, Chair. I'll talk to 2 slides on here. Chair, as far as financial performance is concerned, we are showing that with the funding that was allocated for us, and you follow the column ya mathomo the numbers, we were eventually, after budget adjustments and everything else, we as a department were allocated 62 billion. Out of the 62 billion that we had as a department, we were able to spend 61.3%, 61 billion of that amount that was allocated, and the breakdown in terms of how that money is being. And Chair, just to correct and clarify the issue, there was an underspent here 1.18 billion, and listed is a less than a percentage. If you look at 62 billion and spending 61 billion, because of that's the value the budget here in Leon as a department. Out of that share, that money that was not spent, there's a significant amount of money, over 600 million of that money, that was applied for a rollover, because that money will have been committed in the pipeline, and that money will then be rolled over back for us to then service those commitments that we have made in that previous financial year. It's important then when you say underspending, recontextualize it in fully, so that the department just underspent and nothing happened, and the money that is needed was not therefore go to communities that needed it. In conclusion, say in summary, that's an overall, in a nutshell, a summary of the performance. We are saying there's been improvement overall by 6%, from 51% in the year prior to the year that ended end of 2023 to 57%. There is area of improvement. The areas Tshwane HAST program, where HIV programs are, the issue of maternal child health, women health and nutrition, primary health care, the enrollment, chronic distribution and medication, the issue of HIV testing. That area of work continues to improve. And Chair, and members, you'll remember that during COVID, because of the restrictions of movement and other related, this is the biggest area that had to almost come to a halt. So we are on a recovery mode post-COVID in terms of getting some of those programs getting back to normal. Emergency medical services, we've explained that there's not been a major regression. tertiary hospitals and others, and of course the under expenditure I've just explained at the previous slide, yeah, that 1.1 billion, which is less than a percentage, how we got there, and 98% of the budget, it's really, given the size of the budget, is quite measured compared to other even listed companies, not necessarily. The achievements also, we've been able to reduce maternal death by 16%. That's significant. Women and that are giving birth by 16% of those maternal deaths, the kids will have then born and alive, the hospital alive. Children metrics, including severe acute malnutrition. We still have, Chair, in this province, cases of severe malnutrition. And especially if you compare it against the surplus of food in the province, it's something. Where the communities and Mr. Mokhetle and the team pick up a child who has malnutrition, Chair, maybe just as a point, because it's important. When a circumferential belt that measures a normal growth pattern in a child. So if you come and measure a molotso, what's about how many months or years the child is supposed to be, you find them under. It's the easiest, simplest way you use a tape measure to assess whether or not. The reason it's important is because once that is determined early, that child can be linked to social development, to access nutritional assistance. That child stands a better chance of surviving. And that is why for Sechaba community members, we then say where they suspect that the family might not be able to meet the nutritional requirement, we have a duty to assist that family can then be, one, be assessed, but two, so that kids must not die of severe acute malnutrition in Gauteng. And maybe I just thought it's important, given that where we are and the social fiber. There are areas that's more rife than others, like in the West Rand and in CDB. And I think there's a logical conclusion we can drive around. Increased coverage of client screen rates for various health ones. So, who screen about for various conditions that, like I said earlier, Chair, most of the time. We are just struggling with compliance. We assessed your blood pressure is slightly too high. Please take medication. I take just for 1 month, and I think it will go away. Once you are committed, it's something that you must commit to for a lifetime. So those are the issues, Chair, we struggle with. In conclusion, Chair, we are making some recommendations that we are saying that in that report that we've presented and the mixed bag of performances, there are areas that we are committing in the current year to invest, including recruit our record ambulance, to invest time. Also, Chair, where it's a recreate space that the ambulances must be as closest to the community as possible. There is no point in having an ambulance respondent from Roslyn Itlam. You are never going to make the response time. So those are some of the expansions that we suggest. The sustained the expansion of positive trends, the testing, the screening, and other related issues, who improve our referral pattern, who continue to patella the suppliers in time and when as quickly as possible, of course, paying for the quality the services that rendered. The issue about improve infrastructure development and compliance, it's one of the issues, Chair, we continue to invest energy on. Amongst the other issues, Chair, I will also make reference to. So in a nutshell, Chair, the department improved by overall 6%, was able to spend 98% of its. There are areas of core health services that are improving: maternal child nutrition, public health, and that's part of the science of post-COVID recovery as we're trying to normalize. Chair, in a nutshell, that's the annual report. Thanks so much. Thanks, MEC.
Yeah. No, thank you very much, HOD and MEC. I get Ludwile Waholo. Ludwile Moloreng le Fapalo Hono Fitella. di target tsa bona tse loreng they had set for themselves. Again, mar lo utlwile hape mo loreng o nnile le makoa. Reporto e presentuleng e ntsha le makwao. Mara ko bofellong department ya boa hape e tla ka di recommendations tsa hore makoa ra bonang mo nakong eo re nahana hore re ka lokisa yang ho tswella pele akere. Mara ba tlo lefa monyetla le lona hore le buisane le reporto e hore mohlomong ha e le hore le na le di recommendations tse le hore le ka thusana le lefapha ka tsona le lona le kgone ho di tlhagisa akere. Mara before ke tsea a ke itse hore MEC, do you maybe want to add on or you're fine? Okay. So
One.
yeah, e betere thata ne? Yeah. So re tlo le fa monyetla ke re bagolo. Ke tlo fa ntate Poho. Ke tlo fa monyetla o tlo re thusa fela ka o tsaya diatla. Tse le reng di batlo go botsa dipotso. Bontate a be le lona ntshwa lona ya re tshwenya. O go letse gore se ka nna le mathata. Ntate Poho tlo re thusa gore facilitate la session a di question. Re tlo tsaya matsogo akere. And then re dumellane ka molao gore batho ba ile go bua sebaka se se kana-kana gore re kgonne ho na le nako ya gore re ka arabela dipotso tseo gore motlhomong dintlha di-suggestion tse le nang le tsone akere.
Thank you very much, Chair. Ki kopa ba banang le dipotso ba emiseng matsoho. So ke tlo lefa di number ne, and then you must remember your number. But in the interest of time, ke tlo kopa re keep a comment ya rona at 3 minutes. Ntate o tlo ba number 1. Ntate ka Katiba Yensu number 2. Ntate ka Katiba Ready number 3. Mama ka Camouflage number 4. Abuti ka Tope Ready number 5. Mama ka Springbok on number 6. Mega Tuke Blue on number 7. Next to you, number 8. Number 9. Number 10 ka Katibenzu. 11 ka Skipper sa Youth League. Number 12 mo ka Skipper sa Ready Mom. And then 13 kumuraw ka di Brele. 14 with the red beanie. 15 ka Katiba Yensu. Then number 16 mama ito ba wena ka tuku ne. Kwena number 16 ma wabufela. Oh, okay. Then after them, number 17, number 18 ma'am. Number 20 wabufela. Kwena mama ne. Yeah, number 20. Thank you very much. Number 1. Yeah, okay. Oh, okay, so the suggestion is that you could rete to one side so that it's at the and then we will take them in that order. And then on the left hand side, you can stand this side as well. 3 minutes. Ne? Thank you very much, Baholo.
Thank you, Chair. Now, if you like, I must push it to go Mohale seat. Chair, Lanchane, Kivatu Levoha, Mapil, the MEC Kara, only meeting Kada. Now, I got to Levoha, the MEC, who honor this meeting. I want. There were some of the other MECs, Halibilita such meetings. Without Lunal program, with another program. So the MEC is always supportive for one. Chair, Kivatu Wutsaman, Kowena Chair. Hori number 1. This budget in a little fire on ga re bolele ka allocation ya barking what is into is ilakane barking the sheet wa bona o kry gore di sheet di a tseiwa di tswa somewhere and ga di buse ko di and then number 2 e ke batla go botsa chair ke ratile the MEC ntho a e buileng a re o etsa di doctor di ye ko dintlong because there in Mogale City re na le ditleliniki ba fanyana ntlapo bo you name them no makile gwete bo khokho ba rona ba tsoga go senka bo 5 ba ile batla the medication so ke batla that program ya MEC you see MEC is always distracted and check o tlamlela MEC so ke batla gore this program ya simulale ya di doctor di chakele mo dintlong and then mo program go tlile Mr. Muntoe di gana a presenter there ke man for HOD gana presenter a re the SGP working the board the hospital board they are shorter so re batla gore o simula go advertise in those programs so that rona fana re ne le tsone and re batla go MEC in Mogale re na le hospitals se bitswang Yusuf Dadu ke batla go Mr. Muntoe a le ko infrastructure gore that hospital o simula go se lokisa lena because se sa tala sena 100 years re batla gore le se lokise the issue ya bofelo ya di ambulance issue ya di ambulance you know chairperson o thusitswa bitsa di meeting because the ambulance di ka stress o kry ngwana o tlhabile or walwala ka 9 ambulance o tla ka bo 3 so re batla gore that facilitation re ka etsa ile che le bua ka bo di HIV and AIDS a ke re go di clinic na gona le this thing ba di bitsa in the clinic ba di bitsa batho ba ba telang batho go dintlu ana batho ba sampane ba le teng na so in my closing tatepo ke bone go tswe ANC da a ke ke ANC wa organization or ke ANC wa go hospital can you explain that thank you
ba tlo fana ka tlhalosa akere yeah antenatal care akere antenatal care bagolo he lo re se no ba tlo se butsisa se coverilwe akere o ka nna wa ra potso ne ke ba tlo e butsa e butsitswe akere skwa kra o repeat akere and motlhomo o na le ba lo re bana le dipotso khotla di comment tse le di ba tlo feta 3 minutes re ba tlo la advice gore ha ile re ho yao re na le re mola ke re la mona ke tlo memelisa ba re ke ntate Makola emela ntate Makola ntate Peter Makola ke re emela la mona ntate Peter Makola ha ile re le na le ditletlebo tse di tseneletseng go feta 3 minutes le ka nna la ikopantsha le reo le ne and then le sharing di number o tla gone o thusana le lona ke re yeah a re tseba wa latela
lebitso ke Jabulane Mkhonza ke tswa ka Letsakane Ward 83 ke le member ya botle ba madoda Men's Forum le PCC se ne ke batla skopa ke utlwile ha o thwe ha batho ba test ona le batho ba testang but ba phite ba nyamala ba ske ba phite ba tlhoko ba bonahala but ke utlwile MEC a re batho ba ba latella mahae so ba ha ba nyamalla ho irang ka bona then issue ya bus 2 ya di board members tse shotang o thola dipetlele tse ding una le board members tse 2 kapa A1 for nako e telele but go tula ho thwe ha ebe board member A1 ya resigner that board is no longer constituted ya boraro ke ya di 24 hours clinic tse badilweng le rona ko Tsakane ne re ko por Tsakane main clinic ya rona ka bane sa le re tshepiso ha ine qalo a hiwa wa di tlo ba 24 hours le no ha iso be 24 hours ne ko kopa o butsa taba ya THP traditional health practitioners hore yona le etsa byang ka bana ha isa le ho thwa ho tlo sebediswana mmoho le ba dipetlela but ha re tsebe taba ya teng hore fella kae MEC ne re kopa hape hore ho di clinic committees ha isa le re bua taba ya stipend le hona jwale ha re so utlwi next hore re a thusahala kapa bjang ka ha ke hopola hantle taba ya di clinic committees ha o qala taba ya community participation e sa le qala ka tsona di clinic committees so le no ba bang ha o hlahela ntho tse ding bona ba di fumana stipend rona he sa le yeme ne re ha mohlomong mmuso o kgona ho fa batho di 350 ba sa etseng sepe rona ba leng teng re thusang re kopa le re shebelle le rona re a kopa tswetswe
Ye,
ke Tsakane main clinic
Tsakane clinic,
Tsakane main clinic
main clinic.
main clinic
Okay, Tsakane main clinic.
re leboge le gele stala ne re kopile hore ka bane gele stadi ne na le EMPD so EMPD sa la e futuga wa bana le vacant space ra kopa hore space se ka bane gele stali ke pleke e nyane pleke e ne se tswa ke EMPD ha e fuwe clinic hore e sebediswe so re utlwile hore as if nkare e se ba e lokisitse hore nkare e clinic ka kena re a leboga mo
Okay, Nora Lewa, thank you.
Thank you. Lebitso ke nna Selaelo, ke tswa ke le Zerebecom Westrand. Ke go Zerebecom ke Ward Committee ya Health and Social Development. Mo ke tlo batla ho leboha hore last year I was here and I complained about our clinic that things like LED nesa it's next. In kana kwetelle go lukisa di clinic ya rona ba tlile ba tla ba tlo ilukisa ke a leboga ke tlo bua hape ka bara I was admitted 6 years ago and then I was admitted again in another 4 years ne ke na le problem mo busigu ha o robetse o tsusiwa ka bo 3 ba o botsisa hore o sa phela na and ubutiswa ke batho ba berekang go mortuary private companies. Last week my uncle was admitted go bar and the same thing happened. Ke botsa hore if ne ke le lekgowa ne tla dumelwa na tho because last time coach Helen Joseph there was that white man and alla ka batho ba shweleng ba siwang nako telle. Now it's still happening that thing. So you need to check that thing or why go dipetlele go tla batho ba di mortuary ba traumatize batho ba rona.
A wa khona o kra lebitso la motho wa go mortuary?
No, I didn't ask.
Okay.
I didn't ask. But it's happening, it's still happening. Last week my uncle received the same service. Right. Ke bua ka dikolo. Clinic tsa rona di berekisana le dikolo tsa rona. Ke tla isa example e simple here. Bana ko dikolong ba tsuba matekwane. But they are not tested. Ke di clinic ha re romela bana ba hore ba ile testiwa ko di clinicing ha ba testiwe. Ba re botsa hore tshwantse ba ye ko dipetlele. But ya no re na le problem e kgolo mo location tsa rona tsa di drugs. We are asking that bana ba ko dikolo tse tsebewang hore di na le problem tsa di drugs. Before school se ka di holidays bana bao ba ye ko di clinicing ba testiwe for di drugs ere ha ma teacher dikolo di bula ho ska ba le problem e ya hore no ngwana if o na le di drugs mo mmeleng a dule gae e be problem ya di foreigners. Sorry, excuse me.
Yeah, ibe ya mafelo ntate.
Ibe problem ya di foreigners. Ale di foreigners mo di clinic tsa rona di kena fela di ikela di drugs ba ya clinic to clinic ke lile ka yona problem e last year is still happening. Ke bua ka di clinic committees hape. Clinic committees government ya rona ena taba le clinic committees tsa rona ba batla fela di reports. And then ke bua hape ka malnutrition Department of Social Development, Department of Health, Halibergisani at all because but what we the food parcel go the clinicing and then hapatole the food parcel ki social development. Ha le berekisane total, kopa le berekisaneng hore re kgone ho sebetsa hantle. Thank you.
Thank you.
Dumelang.
I think baholo ke tlo thoma ke leletse time ne, and then o tla utlwa illa o ra hore you must wrap up. Thank you.
Dumelang batho ba haholo. Lebitso la ka ke Mogole Thai. Ke tswa ko Ren West ko O30. Ke clinic committee ko Tshwane clinic. Me MEC le ntate re na le bothata ko clinic ke gola is plus minus 9 months clinic is na generator e robeile, and ha o tlameha ho sebetsa mosebetsi ya admin Tshwane clinic ko O30 Ren West ko West Rand haina generator e robeile ena le 9 months ke a gola or 10 is not how tlameha ho etse admin ba tlameha ba ye to the other clinic, meriana e dulang ko freezing e dula to the other clinic. Jwale wa utlwa ke stress ke a leboha batswadi.
Sanibonani. Hayi mina ngizokhuluma isintu ke. Hey ngoba isilungu siyahlupha. Ngothobile Mahlomoja from Award 25 ePimville eSoweto. Unfortunately usis mfikwe lapho ngathi akekho. So ngizokhuluma nani nonke enihleli lapho abanye babashayela izandla la. Ngiyabonga ukuthi nibe khona kodwa I'm the one who didn't clap the hands maybe introduce. I will clap my hand the day Joba nisihola kanje zonke le inkinga bekumele ngabe niyazazi ngaba sisireport. If nina ben attend ema clinic wethu locally sishirize banking sonke ngaba sixoxe kanje bekumele nisibone inkinga. Buyani ebantwini. A position doesn't send you to the suburb. Uzowazi kanjani inkinga zethu, you stay in the suburb. Attend our private surgeries or whatever. Come to our clinics. Nishishirize nathi itulo. Yi point engizoyibeka and ngizosane solution. Ngizwile bathi kunabo yini what committee and what. Eziningi zesilungu. Yeah. So I'll come with the suggestion. As more complain, amele uze ne solution. Station bagithi. Station size ngama fresh ideas. Because some of the people are deployed because of the favor of political affiliation. That's why we are failing. Go health department. Baba ngizosane suggestion. Mina engizoyikhuluma nabantu abangasebenzi. Station senzeni i-monitoring and evaluation unit. Ezohlala emakliniki, ezohlala ezibhedlela zibhala ama-report without fear, without a favor. Baba ngizwile ukhuluma i-report but awiveze ezinye izinto ezi-affecta thina. You know ukuthi esibhedlela there's no night shift. It's a hotel, staff. Check istat sakuthi abantu abashonayo bashona ngasiphi isikhathi. At night kucima uyibane ibhedlela. I-patient mayimemeza nurse kuyathulwa or bazomchika. The pain comes at night. During the day there's no pain. Ungaphathwa izinyo manje lisharp. La kuthuleke khona sekulela abantu ipain yavuka. But abantu bashona ebusuku. And again ubaba uqeda ukukhuluma la, uqeda ukukhuluma nge-social development in health asihlangani. Kuloko kuthiwa yes zenzeka kunama drugs ezikolweni but checkani ukudla okudliwa abantwana bethu. Abantu abaphekayo abaphakela abantwana bathatha lokho kudla okufike last year bapheka kona lokho fresh bakuthatha ngama-plastic yaphuma. Siyazibona and we don't report them. We don't report them.
Thank you.
La mele sikhuluma iqiniso kulokuthi abantwana badla amazimba chips.
Thank you.
So siyacela ukuthi nibhekisise le nto leyo.
Siyabonga kakhulu.
Yes, mari ngicela ukunibona emakliniki.
Okay.
a o se mfiko ko Pimville ko batla clinicing.
Yeah, ke go paretse so ba holo ne. Ke batla retse so. A ke re batla le nne specific. A re batle le generalize ne. If there's an issue e lo reng we observile in a particular hospital or in a particular provincial clinic, you must give us the name of the clinic or you must give us the name of the hospital and when that incident was observed. Again, because the danger of generalizing, we are going to end up raising things that we have not observed. Again, so re batla le re thuse or tswa go kae ke clinic e feng re kgone e sala go morao akere or ke sepetlele se se feng akere ya utlwana bagolo a re nneng specific. Thank you very much.
Dumelang ka leina ke Tshepi Motaung.
A re feng o se monyetla ne re kopa re mo fe monyetla.
Nna ke tlo senya nako. Ke utlwile mo presentation ntate ha bua ke batla clarity fela gore if ever motho a tsaya treatment ya high blood e tsaya nako e kae because ke sale ka utlwa ka nako ngwe ba bolela taba hore ha o startile treatment ha o tshwanna ho itloela mare presentation ya ga e kutlwile a bolela taba tsa gore o ka khona gore maybe ha o tsaya treatment ya hao after a month ha o le alright o itlogelle ke yone fela ene ke batla go itse.
Dumelang, nna ka lebitso ke Mimi Ditsele hona mo Garankuwa. So na problem ya ka ke clinic ya rona mo zone 6 ba bitsa Phidisong clinic. Clinic ya rena e serve ke tswa ko 32 ba bitsa 32. Clinic ya rena e serve di zone tse 11 and ke clinic e nyane ina le more than 40 something years e le teng. So ke khale re complaina ka yona a gona motho a re botsang selo gona byanong e depalitated or le reng ka sekgowa kore e wele he le ka e bona yo ke sono ka rona re kena ka mole ka 6 o'clock re meletse ko ntle ga gate ka 7 he ba bula ka mole still ro emela ka mole or if re dutse fatshe a gona shelter khale ne gona le barking le tente e re butsa ka yona ke tswa last week Friday bari ifufile so rena waiting area e rena la ke pula re fisa ke letsatsi so nane re nyoko itse re renka re ke khale re complaina so ke tla fela ona mo re nyoko itse MEC khopela letla mo Phidisong zone 6 before le tsamaya le tlo bona re pela botloko jwang
ya nora itse clinic yo mama na ke a itse.
Dumelang na lebitso ke na Vincent Molefe ke to represent Ward 135 Protea Glen. Just to give a round of applause in terms of saying ke a leboga ka para Ward 20 really ra complain last time to your meetings hore Parakwanath inali Ward 20 it's like a storage. But today, I can say halala to you because I can eat my breakfast there now. It clean, there's an improvement. Okay, ki address the issue just to add up more mama, Phidisong clinic soda mo Garankuwa. It's surrounded by zone 14, which is ki squatter camp. It's kaufela by Gauteng. So it's true what she's saying, Hori. Even though it's true clinically inyani and then kitlemo TDG of employment I'm worried, very worried seriously why all government hospitals, I'm not trying to be a tribalist or what, but why all government hospitals Limpopo who you Limpopo but location ngaba unali manipulative system esebediswang. It's Limpopo only, and which is not okay. We can't agree to that. Get more food supply. Yakodi petlele. Really, lingwana ko crèche. Akasiji dijo tseo. Try to increase the the scale ya dijo tsa ko sepetlele. It's not fair that motho o tshwere ke tswekere and then o le ngwana wa 2 years a kgone ho ja dijo tseo. And then ke tle mo transportation, you are admitted, like for instance, Ward 25, which is Copinville, clinic ya teng ke Michael Maponya clinic. Just now, ceiling iwile, and then there's a turnover as 6 billion rand allocation that was given to Department of Health. And as HOD has stipulated, what billion was saved. That money before iba a rollover, it check all those loopholes the department anything, but di fixa. Kitle mo issue ya transportation while consulting ko dipetlele. Unkwa ke ambulance ka 11 o'clock or 2 o'clock. How kata kwa ke ambulance, there's one doctor ko Lilian Goy, which was called Lilian Goy. It was an eye clinic. After about observe or right about travel injection or bala ko di sofe go tlotsa mause, no transport ya wisa ko high. You know, as compared to Pili, nobody transported one ko dipetlele. It's a show safety about to Pili. With regard to Pili principles, please can it apply on that matter? And then
Last question.
Sorry?
Last question.
Oh yes, thank you very much. Medication distribution. It's a serious problem. HOD, sorry I'm not attacking you, but we present on your report. There will be a shortage here, medication in clinics. The reason why you are hiring thieves, because in our township, you want PrEP, you'll get it in the township. You want Panado, you'll get it in the township. We can't afford that. There's a shortage of medication because of that. Well, just to summarize and close up, Tabaya clinical committees, Ward 25 Copinville, it's surrounded by the Mikuku, most academic hospitals. B2 Kepara or Garankuwa, it's surrounded by the squatter camp. Arena the clinical committees. Arena the clinical committees. To educate HIV. Thank you very much.
Dumelang. O buang ke Tumelo from Brandflay Hodwan. Go Brandflay under West Rand. A ke tlhaloganye gore ke re ke clinic or ke eng bagolo. Like le toilet ya go clinic mole E1. Go tsena montate, go tsena bomme. Gauteng ha ena thusho, ha ena nix. How do you tsuri chief eta mo pelago? Like le medication ba go fa Panado wa lwala, o tla ka tlhogo, o tla ka eng ke Panado fela. So ne ke kopa gore go Brandflay ba re agele clinic because last time MEC natlile a re o tla etsa clinic before the vote. So I don't understand gore no go eletsa gore batho ba vote or yang. Thank you bagolo.
Mama bua ara utla clinic ele pile o rile Brandflay, and then clinic a teng mo gae mo Brandflay
Ko ba dirile.
ba dirile
Ke ba dirile clinic lona.
ba dirile clinic.
E go structure sa Home Affairs.
Okay, thanks.
Sanibonani, igama lami nguZakhele Yika, ngibuya eThembisa eWard 13 Ward Committee Youth Sector. Nginesicelo man, bengicela ukuthi ningi explainele in 5 minutes iNHI ukuthi thina se communities benefit kanjani lapho. AS2 kule issue le eyabantu abatestayo uma baceda bangasabuyi. Besicela sewumphakathi ama security makuba ama security angabe amanesi. Cela ukuthi ama security ayenza umsebenzi wawo le gateini maybe nasemnyango kungabi yibo umuntu makaphuma bafuna ukubona amapilisi. Please cela nisikhuzela ama security ayenza umsebenzi wama security. Yabo. Kule issue ya ambulance.
Maybe rethusa ke batla le re fe di detail gore I want you to give us as much detail, ne? We observe ile go ka that situation.
Wonke ama clinic engihambile.
Everywhere.
Okay, eThembisa eSangweni clinic.
Thembisa?
Sangweni clinic.
Sangweni clinic.
Yes.
Okay.
Enye issue ama ambulance. Bengicela department if usi hire abantu bama ambulance masihire nabantu abahlala lapho, because uzohire umuntu obuya le Hammanskraal eThembisa, and then lo muntu loyo mani mfonela nithi ngihlala eStratini, ithaveni popular, uthi uhlala ethaveni kaSisidudu, lo muntu loyo akayazi le thaveni, that's why ayadelaya ukufika endini, umuntu azala imali. Enye engicela ukuthi sizame ukuthi silungisa between isikolo nama clinics. Kune program ebesiphusha ese-youth league. Besi once a month besihambisa ama pets. And then saya e-clinic sayocela unurse oyi-1 just for 10 to 15 minutes ozokwazi ukuthi athi fahla kancane ngamantombazana. But we struggle to get that nurse ukuthi ezazo explainela abantwana bamantombazana ukuthi how do we use those pets or none. Ngiyabonga.
Dumelang, kaofela lebitso la ka ke Ellen Makola. Ke tswa ko Diepkloof ko Ward 29, Zone 10. Ke a leboga baeteledipele ba rona re lebogela report le everything e le re fileng yona. Hoping the committee tse di tla etsa tiro ya bona ka mokgwa ba re boleletseng ka teng. La pele ke tlo kopa presenter ya rona a tla unrephrasetse ele ya malnutrition. Ele e tla etsang gore bana a tlhokomele ke social development a ka utlwa sentle. And la bobedi ke nane bothata ba di ambulance. I once attended a workshop ha re botsisa ka di ambulance ko makeisheneng re nane di fire department and re tlwaetse go nang di ambulance ko teng, but now ha o sana di ambulance o try for una. When I asked, they said the ambulance se di controller ke the under management wa province. And as batho re le collocation, we don't know about it. Re lwana le batho mo. And an educational re fang yona ka jeko nkebe sa felle me because there's these people who won't get that information. O ka re le ka di use the media platform to give that feedback ele re fang yona gona no. E boele back ko batho ba leng gore ke bona ba le reng re tlile mo ka bone le tshwanetse le respond ko bona le tlile ka bona. And then e latelang ke batlo itse re budget ke a bona gore budget alona e berekile mo go nang di underspending. What happens to that budget? Because my belief is health ke yona one of the departments e tshwanetse e thole enough money. What happens to that setting e ko kae la ibusetsa, because normally if the department didn't use or underspend it tšhelete e khutlela morago. And then engwe ya bathusi ba rona ko dintlong ba batlang ba tlo checka batho, because ha no sheba mo matsatsing a fitileng a kere le fa batho ba re go fiwa batho ke ena ke di NGO or non-profit, but in some instances nantse they don't look after these people ba ba bereka. And we have to monitor, because batho ba batla ko ntlong ba tlo thusa batho kana ko nga kere o bona o ha o re ba tsamaile no ba bantshitse because they were not getting paid. So we must look into it, because ba re thusa ke re etse evaluation and monitoring system re ska ntsha dilo ra ska tseba ko di fellang ko teng.
Last
And
30
then-
seconds, Mama.
Yes, ya di last ke botlhoko. Last time mo TV go tswile ka laboratory ya ko Bara to say e sa letse ko morago ka tiro. Then it came to my mind that raya re lo batla di results, we don't get results. It's because of this backlog. So as a portfolio committee, what steps are you taking to help? Because if batho ba sa thole the results, you prolonging the sickness, and batho ba dira ba sa thusega ba sena di results. Ke a leboga.
Thank you very much.
Sanibonani nonke. Mina ngumama ugogo futhi. Gladys Mazigo from Zone 6 at Diepkloof. Iward yethu it's one iward 26. Lana ke mina ngi veteran angithi ngihamba I treatment elili engoye. Mam nobantu ngukuzwile nokukhuluma ukhuluma into ebalulekile. Uthi wena ama clinic nama clinic funeke njoba nakugula abogogo funeke bahanjele emakhaya, which is true. Sithando sami hayi ukuthi ngikhuluma kami, ngikhuluma ngoba nami I'm one of them. Ngive hayi ngimdala shem. Manje ngishela ukuthi angithi bengihamba lento elile ngoye ngithatha treatment bangifaka ku 3 months bangize bangithumela purple section. Purple section kila babona khona ukuthi iBP yakho ayihluphi. Baze bathi ke kimi mama Maziko no ungabuseza. Ngibirthday July. Bathi ungabuseza bazoza. Ngithi kuye ngikhuluma into engiyazi ngithi hawu bazoza athi ngithi ngithi bese ngivila lapho ukukhuluma ngiphume ngihambe. August idate yami bekungo August ngahlala nje ngamabomu azange balibeke. Laba afuneke bavisite njengokusho kwabo. Bakhona bona bayavisita angazi ukuthi ischedule sakhona sihamba kanjani. Manje ngishele ekutheni isithando sami bahleli azange beze ngize ngaziyela nini Thursday. Khona umunye ugogo same street wagula na ekuthiwa bazoza ama visitors beze kwakhe azange balibeke. So manje ngiye ngathi nangifika mina Thursday ngena lana ku eclinic phakathi sengiyothatha itreatment yami sengithathe everything ne BP. Unesi lo athi ke kimi ngithi ke kuye mfowethu bekubhuti ngathi yabona ke leyo ngizozizela azange kuqhamuke nomuntu oyi1. So niza lokho ngithi ngiyadefaulta no ngicela uxolo hayi kabi ngizozizela uNkulunkulu sangiphile inyawo angibapayisi ngiyakhuluma. Thank you.
And the Committee of Health and lady complaints and clarity on some couple of things, some were healthy. Malume Ezra, this one is directed to you. Hello.
Okay. Agere are tlhompe mabui ne. Ababu are ba fe monyetla re kgone ba utlwa.
I'd like to first start congratulations to the Department of Health, the CCMDD. But the question in the long run, your implementation to the CCMDD, wouldn't it in the long run affect the staff or the clinic, the resources? Because of, as you said, Lensa budget the higher one, Halensa budget they already allocated for the outreach program Lisabokana, for the pickup point Lisabokana. Mara in the long run, for example, I'll cannot determine or with clinic. That's something I'll cannot measure. So let's just say what while with the clinic, but fit the budget and allocate this amount of money for this program. So is it there a way from that program allocated like go that particular clinic or hospital like the programs are they wonderful mara in the long run I could give you for my mathematical stats course in the long run will affect in terms of one CCMD pick up point the chronic diseases mara but clinic and how to say clinic it means to staff camera clinic little petlele asatoka hala gamko in which in the long run nationally for staff camera the petlele too and your for budget the resources camera the petlele too for example if cost petlele na allocated to budget di jogobokan your for if cost petlele na allocated to budget the maintenance gobokan your for because of the program Tirinchitata, Kamara Health, for example, Batubala. And that's a fault they are healthy. In PCS, really fault their health. Mara the program tse implementilweng ko lena ke tse dintsi thata. And problem hape ka nna ke e vanga health where we've sent proposals, like for example, government proposal go health in improving this kind of situations.
30 seconds.
My response was that health are in a budget. So budget alena iloko the program like I said, the 10 that's out tested, the mo hotle di dinche and like but when child utilize it. Can't tell if budget ya the 10 days la improve services ya lena kamara di kliniki. And le complain ya as business people our proposals to departments alena we don't get adequate help at creating even though they improve the services alena. Yeah, sharp.
Thank you.
Proposal o e rometse go kae? Proposal o e rometse go kae?
Proposal I think rometse go the district office, Mr. Makudu ke rometse go office nya hae, Mrs. Hines office, the Mrs. office, and the committee chairperson's office before fitla o sa le go petition committee. Re rometse. Yeah, before 10, I go tlhoka go petition malomeza. Before 10 in the office.
Ya romelle yona hape ne.
Okay, no problem.
Romelle yona hape.
Bagolo le kae? Ere ke simulle ra utlwa okay. Ere ke simulle ka go leboga baeteledipele ba rona for coming here. And in the same breath, MEC a buang ke Koketso Mudiane, ke clinic committee member ya PDSOM 4. I'm also the secretary ya clinic committees mo region 1. Invite nare topile felo gongwe mo mafaratlhatlheng. We are not even aware. We were not even aware that you were coming here. But remo executive ya di clinic ya mo dilo tsa health. And it's very concerning because ke rona gape ba leng hore we need to spread this word to the community gore tlanka kwano gona le dikgantseso tse di le goreng di tsamaisana le lona. It's an error. It's an error on your side. Ke a leboga. Ka gore yalo ke kopa gore le ntetlele gore ke sosobanye di kgantse. One, the condition ya infrastructure in our clinics, it's hideous. It's terrible. And that has to be said in all honesty. Le kafa, kama morao kafa go tswa fela. Re ke ntse ra tsamaya ka passage e ke Phidisong 1 clinic. E ke to ka re le ka ya la ilo bona. Gore go etsagalang ka mo Phidisong 1 clinic. E ka mo morao re tswa fela ka passage re fitlhile. The other thing I see, ke very concerned ka king tsamaiso in which issues of maintenance are addressed mo di clinic-ing tsa rona. Ke rile ke go Phidisong 4 which is a CHC. Ele ka bona Phidisong 4 ke matsapa. Go na le channel engwe e telletelle e leng hore issues of maintenance e tsamaya through yona. It's not only for Phidisong 4. E leng hore we report one thing, le no we are sitting ka challenge o Phidisong 4 ka issue ya pipe. Di pipe tsa metsi meaning di affecta di toilet. It's been years re bua ka kgang e. Now it tloga mo o e ya ka mo by the time e attendiwa 5 other problems setse di tsogile mare letlela ntwe one. Can you look into that? The process is not working and that's a fact and you know it is not working.
30 seconds. Last 30 seconds.
Okay. Ke concerned ka safety ya di kliniki tsa rona. Ko Phidisong 4, a patient attacked, nurses are roba le di furniture ebe aba threaten hore o tlo ba thuntsha. Security tsa rena they are not armed but re kry-a dilo tse leng hore di a tshosa. Can it be looked into? Re kry-a batho ba leng hore they are armed hore ba kgone ho safekeeper di professionals tsa rena. That being said, you spoke a issue ya di trainings and absorption of nurses. Takele botseng Phedisong 4 into almost a year is na facility manager. Le gone nong we are sitting ka challenge ya di nurse, but we are expected to do the most. Re ntse re le CHC ka matsapa a ho hiriweng go gana kae ke signature mang e ganang ho sign. Batho ba tsentsiwe batho ba feditse go di nursing colleges ngwe tsagalang kgante. Let us tell the truth. In that Makudu, we spoke last ka yona taba. You were sitting almost 6,000 yadi nurses. You presented less than 3,000, and I told you straight to your face, because I'm not impressed. You cannot sit or bontaka deficit whereas you should be telling us, can it be looked at? Aho hiriwe. Aleka mo ditleliniking tse a le bone gore go etsahala ke yona ntho e etsang gore ka osane di patient di ruge di nurse because batho ba shorta and le staff morale if you are not aware na re sita ka mo ditleliniking o ko tlase because of what you are doing and ke lona le na ding dithata ya bofelosi le buile ka pela ho fitisa e ka pele hanyane ke ntho nyane le buile ka taba ya medication o teng ka mara ditleliniki tsa re
everyone else or mokhatileng
because
I get a chairperson o directile or where you must go.
And then ke yona problem yona e hore he re tlisa ditletlebo letla after
Paolo are
representa dilo
Arezenso mabele
no it's fine
mabele sister mabele
okay
mabele baholo
ne ke re go boele morago
a ke re go ntleng re dumellana gore kopano ya rona ro etsamaisa ka tsela e rileng a ke re ene be re dumellana gore re tlo fa every single speaker 3 minutes emambele because a ke re la bona samman re le busy ka mo a so ka re tsa batho ba leng ka mo le bona ba tlo bua a ke re so re ikeletsa kopo re rile batho ma modimo tswetswe ha ile re hona le dintlha tse di tseneletseng re na le re ba re ke Peter Makola re kopa fela le re nopolele tsona gore tse dintse re kgono di sala morago a ke re ke kope re ikele di tsenyona because ha re ka fa o mong 5 minutes o mongwe mo re mfa 10 minutes o mongwe be re 3 minutes le tlo complain a be le re run fair a ke re sister wa rona wa di clinics committee ntwa ntla re batlo re le itse gore ha ona le mathata motho ile secretary ya clinics committee re teng a ke re sister wa itse processing mara re mo file monyetla nonetheless gore a ibue mara nako re tshwantse re manage a ke re my sister because ha o ka bua indefinitely re ka se fetse.
No, I can't speak it definitely. I was just saying letla after sebaka ntate since ngwaga o starta kona o fitla gone no we are writing le no MEC is going to get a report ya kotali we are addressing the same thing over and over and over, and that is insanity, and it is not attended to. That is why little bona refitla re nna so. Later after sabaga, you do not know the challenges there. Lenze go di office go di econo. Live the lives that we live. Experience what we experience. And let's see if 3 minutes it when those who are in charge come in. Let us sit and see. Ya bofelo ne ke nya go bua mo issue nya ditlhare ra leboga re leboga thata gore le re fa
mara my sister wena wa re tshwenya
abuti o a
re move to the next person. Let's move on to the next person. It's quite a o senya meeting wa rona a re fe the next person. Re na le patience mara re ba tlo abuse because re dumellana gore 3 minutes ntate la bua nnete mara ke re right time la bua nnete right time bua ntate
sanibona ngikhuluma nolendo kuhle ngihlala ekuruleni ward 55
Cela silaleleni abanye njengoba sasinilalele nani.
As I was reading a portfolio engifundayo I see like a problem at department it's ukhipha imali because it's spending too much in department. I feel like instead of sithenga amapilisi on other countries, why don't we produce our own medicine? Because it's gonna close the gaps. Izoprovidela amathuba omsebenzi, izosave isikhathi, izoyenza sure ukuthi nathi siya improve abo doctor bethu. We have abo doctor, we have ama scientists which are more equipped ukuthi abangayenza yonke lento le esithenga kwamanye ama countries. So if we're gonna spend money like this for the next 10 years, I don't see we're gonna have the same problem. We're gonna come here and speak our problems again and again and again and again, because we don't apply a solution vital kuyo yonke lento le. We need to produce our own medicine. That's a point. That's a point, because we see with the amanye countries, we spend too much. Just imagine 55 billion giving another countries just on buying medicine. Nutrition amanye abawathola kithi amanye ihlahla zakhona. We sell them amanye trees, because the medicine abayiproduceayo, some of them are plants wabo, they are planted in this continent. I feel like lento leyo ukuthi sithenga amapilisi kwamanye countries, it's opening opportunities for criminals. We have drug problems in the community in Sine cocaine. Cocaine is produced in South America, but we have it here. It's not like say transporter from South America to here. No, we produce it. We go buy coca plant as like we're gonna make medicine. Those big companies, they know what they're doing. Snitole ife Limpopo last time, a producer cocaine in ama foreigners. Lo alawa foreigners lawo abantu bangali bamakhathela abaziyo ukuthi lama drugs bawayenza kanjani. They are transporting cocaine from South America to South Africa and make cocaine in South Africa because we have space. We have those private lands which our people they don't see. But my comment is, I feel like the department should make a plan on producing medicine based in South Africa. That is gonna make our opportunities better. Lastly,
20 seconds.
Community as Ekurule Ward 55. We really need this bedlela. Natal spread. We need it back because Fosloras is too far. Some of us we can't go to Fosloras. It's Nabo Mama. Abasebenzi nyabong.
Good afternoon. Thank you for affording us this opportunity to share our experiences. My name is Juliet Matebula. I am from Dobsonville, Ward 47 in Soweto. I've got 5 issues that I want to raise to you today. Your HIV management, can the Department of Health try to work very closely with traditional healers, because some of the challenges that you have in terms of testing people and not them coming back for treatment, they usually, some that I know, they go to traditional healers. So there is a need for you to work with traditional healers. Okay, the second input that I have is with regards to Dobsonville Clinic. It's called Itirelen Clinic. The toilets inside the clinic have not been functional for 2 years. Can you please look at that? Secondly, within the clinic, in terms of medicine availability, on 2 occasions I went there, I took my child there during the flu season. In one instant, out of the 7 medication prescribed, I only got 2. On the second occasion, I only got 3. So can you please look at that? Because also, the pharmacist was very rude. She didn't explain why I couldn't get the rest of the medication. She just said, aweko. She was very dismissal. There's no Batupilu principle there. And also, you must also look at the KPIs for your staff in the health sector, because they are not practicing Batupili principles. I'll still use Itirelen Clinic as an example. On the occasion that I took my child for when she had flu, there were no staff to take vitals. We had to sit there on the benches, rubbing the benches, not moving at all, because the vitals are what indicates where you should go after you've taken your vitals. So for more than an hour, we were just sitting and the staff was not there. And on the second occasion, it was during lunch hour, because I was called at school to come pick up my child to take to the clinic. Same thing happened. Can you please relook at that? With regards to social development and Department of Health, can you please work together, guys? The food that is given to children who are destitute is appalling. I'll make an example. There are days where they are fed samp and pumpkin, just samp and pumpkin. There are days, this one is on Tuesdays, and I'll give you the name of the school, Ludirile Primary School. They are fed rice and soya, and that soya is not edible. If we want our children to be healthy, can we please give them balanced meals? I think the last one, it has to do with safe spaces. Still at the Tirelen Clinic, and I think maybe other clinics are experiencing that. Tirelen Clinic is a 24-hour clinic. If you happen to take someone from your home who is ill at night, I'll use an example. I have a neighbor who had a pregnant child. They had to take her to hospital because she was about to give labor at 2 a.m. As soon as she was admitted into the clinic, they chased them away. And unfortunately, it was not safe for them to go back home. They had to beg the security guard, crying, kneeling on the floor for them to be accommodated just for safety so that they can leave at least at 5:30. Thank you.
Thank you very much. Ludirile Primary, Dobsonville.
Mama, lebitso la sekolo re keng? Modiri.
Ludirile.
No, itirile ke clinic.
Itireleng ke clinic in Dobsonville.
Tirelen Clinic,
Skolo.
Ludirile Primary School.
Ludirile. Sekolo kae school?
Dobsonville, they are both in Dobsonville, Ward 47, Soweto.
Dumela bakgetso ka lebitso ke Olebogeng Khadile Pete ke tswa gona mo Garankuwa mo 31 hentse ke utlweletse the report a ke itse gore maybe it's just an omission or oversight in terms of mental health. As we all know that this month represent what I'm raising now. So my first question is, what measures has the department implemented to address mental health awareness and support services to my community? Are there specific programs or initiatives targeting suicide prevention and intervention? Also, what collaborations has the department established with mental health organizations to combat the rising suicide rates mo provinceng ya rona? How has the department improved access to mental health resources and services? What data and insights does the department provide on the prevalence of suicide and its impact on our population? So, ke tsona potso tse ke nang le tsona, and also sharing same sentiments tse ba di fetisitseng di buitse di mo issue ya gore na re keng se kana ka Limpopo, batho ba Limpopo na re ke bona fela batho ke lebeletse sepetlele se sa rena se. Please ke kopa le addresseng taba e re kopa dikarabo. Ke a leboha.
dumelang baholo. Ke dumedise le boetapele. Nna baholo, mine it's an administrative issue. And administrative issue, it means I'm directing it to the HOD and the political head, which is the MEC. Gauteng legislature kopelo botisa fela potso e one ya mathomo. Supply chain management, tsa dipetlele, there are a lot of corruption that is happening. And ha gona sepe se se iriwang go ka lebella mo dipetlele ke tlo bolela ka se sa rena sa George Mukhari ke Patrick Munyatsi ke tlhaga mo 30 gona le nako e leng gore o krea di patient di sena seshabo ba ja dijo tse ding tse leng gore they are very horrible. The reason why is because the supply chain practitioners, they are colluding with the suppliers. Before nama ifitla ko spetlele I odilo elia 200,000 ifitla ele nama ya 50,000. This problem is known in the entire province. It's not happening in only one hospital, but in different hospitals. But there's nothing that is happening. So nekere re khopela le tseng dikgato gore bothata bo bo fele ka gore at the end of the day, these are the people who are affected at the end of the day. Number 2, department o morago kwa e se le ya re botsa ka di 7 ministerial priorities. 2 of them ke gore staff attitude le gore ba reduce the waiting times. It is not happening. Batho ba bo rena ba tsena mo dipetlele motho tla tsena ka 5 in the morning o tlebe a tswa ka 5 in the afternoon. Issue ya reducing waiting times if let's go, staff attitude is still a problem in our facilities. Babereki ba rena a kitso ba tlhoka debriefing because of the traumatic experience that bayang through tsone di doctor le manese, but really the staff attitude it's a problem. Ko hot 30 re na le clinic ne re propose gore o ka reka bereka 24 hours. Ka gore o ka ska itse gore motho boshogo o lwala nako mang motho o lwala at any time ne re khopela gore at least motho a bereke 24 hours
e bua ka lebitso
ke ngo 30 ko Garankuwa view ino bara ke tsere ke phidiso mang gore ke mara ke go Garankuwa view clinic. And then ke khopela o botsisa gape batho ba boletse mo boletse mo a re gona le issue ya gore ga bana manese. Department here bolela bana ina le moratorium. Priority ki di clinical posts. Anything except clinical post 2 ba buditse dipetlele gore ba ire what we call concurrence. Meaning anything that is non-clinical, it has to follow that process. Mar go lebella mo dipetlele gona le shortage e serious, very serious shortage. Ke utlwile mme o mga bolela gore le presentile budget, unfortunately ke fitlhile lata ya gore le underspendile somehow, but still gona le shortage. Ne re khopela gore issue ya moratorium mo le lebelle di post di filiwe batho ba kgona ke ya service. Number 2, last, I think is the last one.
Child.
Okay.
O tla di sa go ntate ole.
Ke tla
O tla di sa go ntate ole.
Okay,
sharp.
MEC le HOD ba boletse ka dipetlele tse leng gore the structural ntwena ya yone ga di khatlhise. DID it's a problem, it's a headache to the Department of Health because how level a simple mere go change a bulb, you have to follow process ya gore DID must come and replace, and ke yone delay yang gore dipetlele tsa rena di se ka kgona go kry-a tlhabologo e nyakang. And ne ke khopela CO MEC gore ge go kgonagala ne ke khopela re le mo Mamelodi Hospital gona le a CEO called Dr. Sue. I think he's very best in terms of infrastructure. I wish that I heard that he's going on pension in 2 years or maybe this year. He's is going back to China. But I think that man can assist more in terms of infrastructure in the I wish you can have time with your senior officials and assist you in terms of how to deal with issues of infrastructure. I think you will benefit a lot from that, man. Thank you very much.
Okay, so, yeah. Ahe, kiba loyi, what committee member? Yeah, dilo tse dintsi ba di boletse tse lo reng maybe di teng, mara I think ntho nna ke kgopelang kore re tlohele go promisa dilo tse re sa direng, like ke sure the officials and batho bo botlhe ba ba leng mo dilo tse tsotlhe tse ba di bolelang aba di monitore ntho mathomo ke batla ke khopela go bana le transparency, because batho ba berekang EPWP aba tseiwe serious mo ditleliniki ka employment, aba tseiwe serious. Ke batla go botsisa gore wrong ke eng hello re ba bereka ngwaga and ba patediwe the same go tshwana le motho mongwe a cleanang ka mara sepetlele, because ba utilize-iwa mara mmereko wa bona a o tseiwe serious. And then ke khopela hape le hore go na le batho ba ba fiwang di kontraka ba ba bitsa di tender entrepreneurs or batho ba irang ba applyang, because department ya health e le ka ho thusa batho ba ba patele bana ba batho, and I tseiwe serious because of leja le bona ba bona, and I tseiwe serious. And nna ke tlo le bona sorry he ke re I tseiwe serious ke rang, and I'll show you. Ke khopela botsisa lena o mo wane wa lena le mo employment or finance a ememo a re botsora e ba file motho wa di contract go ra tsamae a tlhoma di tente a berekisa bana ba batho SEPWP ba ba patela bokae hona beano ka gore ra itse gore batho ba ba sa berekeng ba ra 350 ra itse gore di pensioners di kra 2000 what why bana ba batho ba ba tsena mo ba sa ya bona e sa bolediwe is because of leja tšhelete ya bona. So today re khopela go bana le transparency and then leeng lo ira home bodies check gore bana ba batho ba hola bokae ba tsamaya mo letsatsing ba nna mo hotlhe ba tsena di house to house. You are not taking them serious. Go changisaniwa ka bona because of o ka re lira mmereko gore le je tšhelete. So now I'm saying, Pidisong 1 le Pidisong 3, Babulate and Lenale Cheletele sa spenta, Babulate, but Pula Yeta Beketang, Mabane Nona le Moya. Copella Ling, Le Chicken di Luteo, and then Reveng Sirias, Baba Sabereking, you Copella Holetali Anna. Baba Sabereking by the officials, Copello Letali and a railway.
Thank you.
Dumelang bagolo a bolela mo ke Emily Makwe from Ward 32 mo Garankuwa. Na probleme ke na neng yona ke ka tleliniki ya rena Pidison 6. Ke bona ka re a le re tse serious because every meeting ra bolela ka overcrowded e ya go zone 6. And then hape again ne ke khopela le mfen clarity ya gore he ke le patient ya go Pidison 6 ba mfa referral letter ya gore ke tshwantse ke go sepetlele or ba mpheya mo George Mokhari ba mfa ya go Odi. And go Odi ki distance ho ya kwa ke namela ha ntšhintši mo nkabe ba mpha e ya mo George Mokhari. So ne ke nyako itse gore re khono kra gore mo George Mokhari re kry a byang le re botseng gore ho iragalang. And then hape ke taba ya gore ka general bo helitlile le tlo re botsa le ka di financial ya tsa lona tsa go sepetlele. Probleme ko hore la tla le botsa rena community, a le botse staff tsa ko ditleliniking, le tsa ko dispetlele hore lona progress ya lona ke eng ho iragalang. Because of rona he re ya kwa re ba botsa hore re tlile mo lona le resource ra ralwa. For instance, antiwaka o tsa treatment ka mo Pidison 6 ya matlo. Ba mo file treatment ya kgwedi ya 2 months, mara every month o tshwanetse a lete eye drop go odi ke transport. So ne ke nyaka itse gore dio tse di bana re di solve bya mo community ya rena ka gore ba bang ba ke batsofe o ka se ye odi kwa ka maoto. Ke a leboga.
Very much. Number 20, the last one.
Ke a leboga Dulastulo. Ke nna Florence Mkonto from Ward 32. And firstly, ke batla fela ke leboga standing committee le chairperson. Chairperson is from my ward. So ra ipela ka wena gore o bo tlisitse legislature to the people. And to the MEC, re lebogela 3% improvement in overall performance. But my main concern is under expenditure area 1.18 billion. Mola eleng gore there is underperformance more child health. You know, children are our future. So we are not happy that even like a consistent underperformance under child health. So department to prevent the death of our children, little premature babies. When it comes to HIV indicators, most of them have improved, but department to the MEC little officials, bring back the awareness campaign, bring back the ABC. If you can listen to the YouTube channels, youth talk casually about not using condoms. So please bring that back. And there's a previous speaker who spoke on mental health. I didn't hear much in the report about mental health. And I'm really disappointed because there is no health without mental health. And I'm overly concerned about mental health of children. The services for the mental health of children. And we know that in our country now, there are so many risk factors for mental health for children. The divorce, the violence, bullying, and then the substance abuse. So department, please do something about mental health in general and particularly that of children. Thank you very much.
Very much, Chair. That sums up the question session.
All right. Baholo ipapatelle matsoho. Ya wa itse gore lengeditse motho man. A bona le go di community tse ding ga o kaya. O kana batho ba bua ka dilo tse le gore they are not related. I get. Mar lona ka je go lengeditse batho gore Dobsonville, Pimville, Westland, Garankuwa, and other surrounding areas. Le reditse batho because you were spot on. I get. That is why I get tell them matso ape. Ore kenya go acknowledge. Mare ereke le boe dintlha tse di tswileng mo in a question format, in a commentary format. I get. Re batlo fa le fapa sebaka se ore se respond to some of the questions tse le di botsitseng. I get. Mare even before then, my sister Ole wa secretary ya clinical committee or clinics committee. Kopano e biditse ke rona re le committee ya tsa maphelo a ya bitsa ke department. I get. E biditse ke rona e be re invite MEC a ke re la e utlwa bagolo ke rona re e biditseng and re e bitsa so e be re popularizer a ke re e be re popularizer mo di-social mediaeng re communicata le di-councellara that is why le bone di-councellara earlier on a ke re so ne ke batla gore re deale fela ka confusion eo ya gore why re sa itse rona ke rona re invite-ileng lefapha a ke re la e utlwa bagolo and then ko bofelelo mo malobeng a fitileng a beke e fitileng because ke utlwile mama Florence a bua ka gore campaign HIV le lona ke batlo le rotloeletsa gore a re tsenelele thata mo nthong ya di-screening a ke re checkeng re itlhatlhobeng mo bekeng e fitileng re kry-ile gore di-number tsa rona tsa batho ba lo reng ba fumaniwa ba na le cancer le tsona ka re di elela o tlhatlhoga a ke re so re batlo gore le iponantsheng ko mafelong a maphelo gore le etsiweng di-screening breast cancer, cervical cancer, prostate cancer, lung cancer, and all these other cancers, li tlhagelliseng a ke re bagolo because hangata re kry-a le gore ha o tlo diagnosiwa ka cancer be le gore nako e setse e ile mara ha le ka nna ntse le ya le i-checka ko mafelong a tsa maphelo re tlo kgona gore re thusane le lefapha re kgone go detecta dilo tse a ke re and e ra goreng gape e ra gore tshwanetse re fokotse dilo tse di rileng se re se kry-ileng he ntse re assessa gore mare ke eng ntho e khosang kankere mo setšhabeng sa rona re kry-a le gore lifestyle changes the way le jang ka teng the way le nwang ka teng a ke re pollution ba bang le lighta mello ka mara dintlo all of those things di na le gore di tsweletse pele bolwetse bo so re batlo le rotloetsa gore iponantshe mo mafelong ao a ke re gore le kgone gore ba le thuse ka dilo tsa bo di-health screening ke batlo checka ka speed le maloko a rona gore motlhomong go na le dintlha tse le gore maka batlo dintsha ke a itse ne se se re ditse ka yona kgannye mo bekeng e fitileng mme o na le dintlha or o siame alright ba siame so e re fetedise ko lefapheng MEC
Thank you, Chair. Ndiyavuya kakhulu Chair, but ukuthi you have clarified indaba yoza kwethu apha. Thina sibanazo ezethu meeting yene community. Le meeting yakho sibizileyo kuyo ukuthi sizocacisela i-community ubasenza ntoni na. Any report yethu ye-annual report yonke yonyaka othe masoba uthulela yona. Part of the things abazireizayo ke yile yoba funeka siqinisele ngifuna uthatha likamama i-awareness yokugcina. In the province we have 5 regions. In the 5 regions we have district chief directors. Here in Tshwane I've said Kintate Makhudu iyavakala ngo apha eTshwane ngubaba Makhudu that is responsible for that with his team that work with the central office that is led by Refilwe. As we speak here, esidibeng kunabantu be-health, aba-screen abantu, aba-check abantu in the communities. As we speak here, at Johannesburg, u-chief director wakhona, usemphakathini ebantwini, doing the same activity that we are doing. Because we want to prevent diseases. Manisibona silapho, as a responsible for issues of HIV and AIDS, we are even expanding our services, opening some clinics, mobile clinics. Abezanazo, we check abantu even ifuba zabo inkinga yakhona esifuba, inkinga yakhona ontweni ngxaki. Nasekuruleni is the same. So every day my teams go out. It's one thing that we have started strengthening in October 2022. That is why I'm saying Mauvuka, check and where is the district office? So share contact is my district offices when. So that if there is something that is not done, like Usisi, OT a deep kloof about deliver longer EPLs. I'm disappointed because I know a deep kloof in one area is at Kalangayo. And I know a deep kloof that's where ogogo bakhona bathi ndibabiza nje bayatefa. Udame emnyango wathi ungezi namhlanje uze ngomso ngoba ndisaye emngcwabeni ulethe amapilisi wami kusasa. So I'm worried ukuthi ngubani lo allocated umama phayana because we have allocated people area by area. Uba angezi longo August we'll have to make a follow up si check uba bekwenze njani angafiki because mayengazukuza uzodeliver ukhona omnye that must go and deliver. Besides that, in all the clinics zethu ze province sine CCMDD leyana esifika sikunikeza SMS ethi izolanda treatment yakho. Then after 3 months you get inside the clinic ucheckwe ke ngoku so that we don't continue with the treatment kanti ngoku sekungcono sisakunikeza lamayeza besinike wona kuqala. So that's what we are doing. We may not master it. Nindive kakuhle abantu basekhaya. Singangayenzi kahle kahle because into esiqalayo leyo ngoba sifuna ukureduce ama queues because ukhona omnye ubhuti obuzileyo wathi nenzani ngendaba ye queues in our clinics. We want to reduce those queues. That's why sisiza kuwe. I program yethu in fact esilaunchileyo silaunche 2 weeks back eToti city siza kuwe. We have a program silaunche a deep kloof a deep slot siza kuwe siza kwakho. Then saphinda salauncha enye program ethi ziveze yihlahise. If we are defaulter siyakucenga siphinde siyobuza ba yintoni na. And what we have done now, no comrade Faith, we had a meeting of integrating our work. Lantuma mebe ichopaya. We want kandi fumana umntu odinga ukutya. And ndithi kulo mntu lo ngoba omnye umntu akatya amapilisi because akana kutya ekhaya. So we have agreed that we are going to integrate our programs. Xa ndibona umntu ogulayo ofuna uphuka ukutya, my team indicates with social development. But nanxa sikwezi ndawo kwi-communities chair, sihamba nabantu be-social development, babafilisishe ama-form abo, so that they are able to get food. But in the meantime that you don't get food, what do? Siye sibacela abantu basixeleleni so that we are able to assist immediately. Kube nento oyifumanayo. We even have some of the service providers esihamba nazo ezisipha ukutya mahala for nutrition. Xa kuvalwe izikolo where we are sihamba siphethe ezinto zodubela abantwana imovite nezinye izinto sibaphe siziphuwa ngabantu lezo zinto lezo, including ngoku all the service providers siyabacela ukuthi mamasiphe ama dignitary packs because masisaphayana phakathi kwabantu kwi-community kunabantwana abangamantombazana that doesn't have pads. So kwaza zitendi zethu masizani nizoscreena, we give those kids ama pads. So anikwa ngama service providers so that xa ehamba uhamba ene party pack yakhe akwazi baqhusheke akwazi uye esikolweni. Because besides that we work even with the schools. We have a program called Health Integrated Program. Apho siye sathenga amabhaki saqasha sister. We have even brought back the old retired nurses. Zihamba nathi masisiya kuma community just to dig in the schools to deal with the programs zethu ezifana nalesiyenzayo nayo kasiza kuwe. Siye ezikolweni sifike si check abantwana siyabascreena. Asiyenze only ngoJanuary. That's why sithe sifuna sasiyinxa kuthiwa kuvula izikolo kuphela. Nabanye sibascreena nento ze cancer, abanye sibascreena amazinyo abo sibahlambe namazinyo, sibabonisa how to brush their teeth, all those things. That's what we are doing in the Department of Health. Ngoba sifuna ukuncedisa ukuba si reduce these queues in the hospitals and queues in the clinics. And futhi nina apha anina district hospital. Yenye yento sicinga yonke umuntu ogulayo uyapha eGeorge Mukhari. George Mukhari is an academic hospital. Nifanele ukuba sinakhele isibhedlele yiyo lonto sibhizi ngoku besifumene indawo kumasipala che but indawo yakhona ayikho right bathi landfill site now. Sikhangela omnye umhlaba because we want to build a hospital here so that we ease up the pressure. Mawususwe clinic uya ku-district hospital before usiya kwesisibhedlele esikhulu. Atsho njalo amaXhosa sisibhedlele esikhulu but sisincamile bobhedlele obukhulu ngoku. We even say they must use some clinics ngaphakathi phayana so that they can help people as clinics. So mawubona iqueue eninzi ephayana uboyazi baba abantu abana bafanelanga babapha. bafanele baba ku district hospital, bafama base clinic, but I'm saying to them, you are not CEO going to chase them away because Bella. And then funa unixelela futhi izibhedlele zenu zase Gauteng ni service abantu abasuka kwamanye ama provinces nina. Abantu abalapha ngabantu base Limpopo, abantu abalapha ngabantu base Northwest, abantu abalapha ngabantu base Mpumalanga. Ndingaya ngoku ndifike ndibala ityhu ndiyaya mna ezibhedlele. Ndiyabala 1 2 3 ngowaphi usukaphi. And abantu aba even litigated as chair are the people from other provinces, not here in Gauteng. Umuntu okuthi obeqhaqhiwe uza ebole ngaphakathi chair aze apha kwesisibhedlele. Xa sesifa apha kuthiwa ubulewe apha kodwa uqale wamosheka eNorthwest. Akathungwanga kakuhle eNorthwest, mathina sizowulungisa what has been done ngoba si-academic hospital kuthiwa ingxaki yethu. Ibe ibingeyo ngxaki yethu. Silitigatwe ngumuntu ebemoshwe ngale kwiprovince yakhe. Silitigatwe ngumuntu ebemoshakele eLimpopo apha. And I want to tell you again, remember, this hospital is just right in the doorsteps of Limpopo. So it's going to be difficult for you to nina nonke nihlezi la eMosteni, anisuka Eastern Cape, nisuka la eLimpopo. And your children are working here. Your children, when their parents are sick, they take them babazise la. And your children, when they finish i-practice zabo, they come and work here. Nansi ngxaki ninayo. So andifuni mntu ke namhlanje ozawuphinda athethe ngabantu baseLimpopo, because ngabantwana benu that have applied and they are working here. If ndithandi bafuni nxa be-aplayile ndizawubakhetha kanjani? Because I'm not allowed to do that. All that we must talk about is to service everyone that gets in the hospital. Let's not discriminate. Here again into ngoba lapha abantu abalapha ungowaphi wena? Because now ungowalapha. Uvela apho mama akho notatakho. eGauteng ayondawo yamntu ke le. Yindawo yethu sonke. Not a single one. Owala masijonga ifamily tree yakho. We look mamelani la mna ndizanixelela inyani. Mamelani la ndifuna sithethe inyani namhlanje. Uthe uche, let's talk the truth. Let's talk the truth. Thethani inyani. Your background doesn't come from Gauteng. Apa abazali benu. Abanye basuke eMalawi for your information. Abanye basuke eMpumalanga. Baza usebenza la befuna igolide. This is the center of gold everyone wanted. But you happen ungamoshi meeting gache uza kuma ufuna ucaciselwa ndim. I'm giving you history now because nenalo tendency of thinking that here indawo yomntu le. But we are making it now a better place for everybody. So here again lonto eniyenzayo nina bancinci. In fact yenzwa ngabantwana lonto leyo. Even my children were born here. Bathi ngabalapha.
Can we
listen?
Can I request that we listen?
Listen.
Can I request?
Listen.
I know you might not like other things, but
yes, Chair, thank you. Masiniqale linyani yomnombo eGauteng. Ene kitla ifita Chair, but after this session, ndifuna lo othi yena ngowalapha andizomxelela ubuvela phi na. Ndidlule apho andizanga langa nto namhlanje. The other thing that we want Mamelani, Mamelani, andiyenziwa ke mna ke lonto le. If you don't want me to talk, ndizawuphuma mna ndihambe. Yes. No, you can't do that. You can't reduce me to that. You are not going to call me here. Ndibizwe kule meeting and reduce to that. It's not done kum. Ofuna uthetha nami makame ngaphandle andilinde azothetha nami kakuhle. Ungamoshi meeting yabanye abantu. I am not going. I am a leader that is respected by you. You are not going to reduce this meeting. Abanye abantu basuka kude abazelanga uba bazomamela nina abantu abahawulayo. Howlers must go out kusala abantu abadecent kule meeting kaChair. Abantu abadala for that matter, who knows the problems that we are talking about, who are concerned about the health issues in this province, who want this government to work together and service you. So akuna mntu ozawufika hawule acinga uba siza kumyeka Chair hapa. Yiparlamente le namhlanje eze apha. And you are lucky because they should have chosen another place, but choose nina. You are not going to treat us like that, comrades. Because I know people that are doing that are comrades. You are not. Yenzeni papa ngicela uyenza lonto leyo, not here. Don't come and politicize this meeting. Yeah. No Chair, bensagqibezela le ndaba. Then there are issues of the clinics that I want to raise, but I know HOD will talk to it. Kunama clinic, mama no data, that are serviced by the municipalities. Kunama clinic are serviced by province. But you have realized that this is not helping us. All the clinic committee members, bayayaz balay clinic abasebenza kuyo, yeka masipala na orika hulmente. What you have picked up, that's a delegated power, ye province, ye department, ye health leyo. There is an allocation that we give them every financial year to assist those clinics. But into siyibonayo yeyoba, lama clinic ayafokola bantwana basekhaya. We are a clinic, I've been in almost all the clinics in the province. Ufika kunet bedroom ezingasebenziyo zimbini, enye ayisebenza enye iyasebenza. But what we have decided, myself and the team, we are not going to stop servicing those clinics. Makuthiwa kunama bandage, send a message. Makuthiwa kuna aspirin, send a message so that we send those things immediately. And we have said to the infrastructure team led by Galata, all the clinics must be at the level that is decent for our community. So siyazilungisa ezo clinic ngemali yethu. Asilindile kamasipala. Clinics that you have said, that's why Chair kept on saying, which clinic? Because after this meeting, the team Galata led by the HOD, it's going to go to those clinics so that we can fix the problems that are there. Because remember, even the NHI that is coming now, NHI want us siqinise ama clinic, nama district hospitals, nama regional hospitals. Ifocus yethu funeka ilapho, sincede uba iclinic zibe indawo ebukekayo. So sizaba busy ke ngezo clinic Chair, we will go and make sure that they are at a state that is expected by government and by us as community, because abantu abaye clinic is families zethu. And nathi sifuna abasezi clinic instead of going and pay money kuma medical aid nakuma hospitals, private hospitals. So we are going to make those places better. So siyacela if une clinic oyilibeleyo nawe awayiraise uba inengxaki, nithumele kuPeter, because Peter will make sure that we get that clinic. Nithumele kwi-team kaChair, Chair will send that message to us to make sure that we make that clinic a better clinic that must service our communities. Kuleyana futhi ke yama nurse bhuti unyanisile. Sinengxaki enkulu ye-employment. Kwake kwastotshwa ukutraina ama nurse. I'm sure some of you are aware. Abanye may not be aware. Now we are resuscitating that program of training of nurses because it's an important program. Because la ukustotshwa kwama nurse bangatrainwa, abantu abakhoyo ngoku bayaphuma kwi-system badala baya kwi-pension. Now we are left without senior nurses, especially your midwifery, nurses that must take care of mental health patients. Ngoku sibhizi ke siyariskila ke sivule i-unit now, Chair, in the department of reskilling those people that are inside, but training others. We've signed a contract with TVET colleges so that we can continue with that work. Even yesterday in the report, the team was giving me the work that they are doing. Siyaxolisa kakhulu because siyayazi ba nurses, it's one area that we are very behind as the Department of Health. But we are going to pick it up in ndaba yakhona. And kunotata uthethe ngendaba ye-EPWPs. Indaba yama EPWP indihlaba tata njengendlela nawe iraise ngayo. You can't have a person that is an EPWP working for more than 10 years. Ehola 3,000. Ayo 350 tata kuthi. 3,500 pesana ngithi. So sibanikeza lasa stipend ngoba it's money from national, he grant. Ayo mali esuka kuthi as a province. Sinikwa is national and all provinces are supposed to get that money. So thina ke sitheke ngoke uze sizame ukuxazulula this problem ye-EPWPs. We are taking them to school so that siba train when there are opportunities they get employment. Siba qashe siqale ngabo uqasha. Sizama nokwenza secular chair that says we will have adverts that are focusing internally so that we can take internal people before we can even extend it outside, especially targeting the low categories zethu, including EPWPs. Ngoba abantu bayasebenza indeed, some are data capturers. That's why ummepesani wenze ngoku neprogram yokuthi sawukhuluma nabantu basincede nokuba trainer on ICT skills so that they are able to be trained and we are able to take them to hospitals as data capturers. So there is that improvement that we want to do. So that unit now is alive, yes, skills development in the department. Because ufuna unceda kahle kahle bona aba esiyaziyo ba bayahlupheka kakhulu emphakathini. Ene bayasebenza esibhedlela udlula wonke umunye umuntu. Kunendaba chair that I want the committee to help us with. As I've whispered in you, your recommendation. In other provinces, abantu abakwi clinic committees bayanikezwa isente nyana yokukhwela e-clinic. That amount is about 500 in other provinces. So we've written to Treasury tina a province la, nathi sicela ukuthi clinic committees must be given something. You can't have a person that go to the clinic ayosebenza the whole day, committed, but we don't even give that person a cent. It's not fair. So silindile ke Treasury ukuthi siphendule because bathe bazasiphendula akuna mali but sizawuphendulwa. But ndicela out of this meeting because take ndaba yiyo imember ye-committee nam i-recommendation efana nalena ndincediseni because if isuka kuni ukuthi clinic committees that are working in these hospitals need something, bindenzeleni lo recommendation leyo nindicela ukuthi xa ndiyango ku Treasury ndiphethe ngoku i-recommendation evela kwi-committee ethi let's make sure that we strengthen the clinic committees because they want to work and we've improved now in terms of the numbers. So many people are members of the clinic committee and they are not working, most of them. I even said to the team, when there's an opportunity for EPWPs, let's start bringing them even through EPWP. EPWP, but be manage a clinic at the same time. So those are the options that we are doing in the department. Because the department, at some stage, for long, we didn't have money. Now we're starting to bring back to spend money, even to pay service providers. So those are the options that we are doing. We are taking care of that issue. We will definitely be assisted by the committee to assist us to beef up my recommendation. That must go to Treasury and the Premier to ask for something that must be done. Because when I asked those two provinces that have done it, Nabo, they said they worked net committee plus the Premier's office by Netisana presenter budget council. And I think it's going to be possible, Nalapa Gucci, if we must go more than even 100% in our performance in servicing the communities. Because they need us. You are here not because you are here because you need us. You need us to do the work that you are supposed to do. So ubukobe naibo bukonje. Anizanga nje ukuthi nizochitha ixesha apha. That's why abanye phayana otata no mama bebede bethi benikhona. Then kuna clinic yase Brandflay che. I've been there not once, not twice, not thrice. Nditena ngalamini kwakulevelwa iBrandflay pha ngabantu bayo. Ndandikhona ndimo ethethe nalatata walamhlaba pha ukuthi makasinika umhlaba because we didn't have space che for the clinic at Brandflay. So ndifuna ukuthi ke ntombazana yasekhaya bendingayelanga ngoba bendifuna ama-elections bandivotelwe. Umsebenzi wami ngoba mandiyonceda umuntu noba lo muntu uzawuvota or akazuvota. So ndandiye pha ndiyofuna uba laa clinic expandwe because ayikho che akuna clinic pha ngamazozo abasebenzela kuwo. So sibhizi ke ngoku uGalada ukhona phaya neteam yase-Western sibhizi sizama ulungisa uba sifumane ama-container ngoba umhlaba sesiwufumene to the owner yase-Brandflay. Sibeke ama-container so that we can have more services that we do as it decent for the community yase-Brandflay. That's a rural area, che. It's Ward 1 yase-Randfontein. Yi-base yam, che, mna mntu ngala language yasekhaya ke Maqabane. Yi-base yam leyana. So that's why ndithi andiyangakanye phayana. Ndiyayazi uba there is a need for the clinic. It's important. And abantu bakhona, utata bakhona, they are very happy about even the steps that we have done now. So kucathula kancane sifumana umhlaba because wawungekho. Now those containers must be delivered. Then the services can be moved from those small konanyana zingene endaweni right. We are taking care of it, che. We are going to deal with it. Kuthiwa ke kunabantu abacollaborate nama supply chain HOT ababa ukutya inyama. Ndihlala nsithi ke abantu banesono abantu ababa ukutya kwezigulane. And we know that sometimes izigulane zethu ziphekelwa ukutya okubi. Sebefikile abantu abana bayatrainwayo. Nditheke because ndabona ukutya okubi mna apha ndazenye indawo. Ndibonile apha eGeorge esafika la bhutilwana oyiCEO yakhona. Ndathi ndababuza ekitchen that nonke nizawutya oku kutya. Not a single one starting from the CEO must eat outside. They must eat that food that is cooked in the kitchen. That is why now, since I get chair after that, he contract TVET colleges. Students now as a chef, those are the students that are in these hospitals. They are preparing a meal, and they are monitoring that. So, right. Then the other hospital, you are right. And as I think office, this is the best well-run hospital chair. The telecommittee na chair. Because must compare, I always say to mind comparing it. You compare me with what? Compare me with Mamelodi because all the CEOs, zonke zezibhedlele 37 of them, ndithe umntu owakhayo noba wakha bathroom uzayothatha ispec eMamelodi because we have renovated that hospital yaseMamelodi with only almost it was 10 million because it's 9 something to 10 million, and we built a private hospital ngalo mali leyo. And I know if my other person engazumbiza ngegama yayisenzwa nguye besawubhatala 200 million to renovate iMamelodi. So it's the best well-run hospital. So ndabathatha bonke ko CEO che ndabasa phayana. Baye bonke che ndicela ke ngoku che uye eBhethaxowa. iMamelodi Bhethaxowa or the best na udlula yona. Ndicela uye ePhulusong. Matcha iMamelodi. Ndicela uye eFar East, it's matching Mamelodi. Ndiyakbalela che zo 37. I'm sure ndishelelwe i10 qha where I can say ayiyongo. The rest are at that level because akunamntu owenza anything without that benchmark yakhona. So all CEOs now are running that the benchmarker from Mamelodi. So those are the things that we have done, which we really appreciate. Malotane gqibezela ke ucelele abantu ba yintoni engayiphendulanga apha but ndizamile ngokokwam kwelam icala ukucacisa but chair were available if you want reports in some of these things. I always say it's good when I give you information with a report, a file. Sicela mawufuna ifile ye improvement in the hospitals sizokunika because sinayo even before you can go and check which one that we have not performed. Enkosi.
No, thanks, MEC. MEC, what are the questions? I think the issue at the clinic and the clinic, but the MEC mentioned several of them, whether it's Sakani, Tshwane, Zirpekome, Sangweni. Team infrastructure is committed, as the MEC said, will go just to attend to some of those issues. But some of them are known infrastructure challenge. Western, Park Home, haona electricity, haona municipal infrastructure, a generator. We are fully aware the generator is being repaired
and we're trying to get the power going. But I think the long-term gain is to get the bulk infrastructure mola and a proper building, brick and mortar. That's the permanent solution. Obilele cross-cutting issues around the ambulance. Shortage of the ambulances, how difficult the inter-facility transfer. And I think some of these issues are known, but I think there are two things maybe as a public education thing that the ambulance am saying. One, let's just make sure that Revitsa ambulance just for emergencies, because there's never going to be enough ambulances just for the purpose of moving us around. Two is, let's make sure, because ambulances are provincially run, centrally. Here only more cell phone, 10177, it will direct you. If you only more landlining or more cell phoning over that direct access to the metro control, 011-564-2210 or 011-564-2211 to get direct. Because here is data analysis, trying to understand why ambulances were delayed. Sometimes there's a percentage, not all the time. Sometimes there's a percentage of phone to police station, that adds to the delays in sometimes. Of course, sometimes has to do with the availability, low prioritizer, the lots of the ambulance. Issue here, everybody clarify, severe acute malnutrition. Hengwana vele wako clinicing, ba ufa road to health chart. That road to health chart, you want to hore ngwana was 6 weeks, must be weighing so much, even so much circumferences. That clinic chart, and the reason you keep hugging is for that reason. You are able at any given time. That's why ngwana vele about teacher yon. O khona o bona hore ka kgwedi tse kana ngwana santse a weigh this much a khona o ba o mokana. At any given time, any of that chart le ngwana disamage, it's a problem. And some of it about malnutrition, as an example. It's not only, always. And that is why we can tell malnutrition, or severe acute malnutrition. Underdevelopment during that chart. And that is why the interventions, one of the speakers said, making sure the Department of Health and Social Development in those cases where tuso hang for one, the child can be assisted. I think, Chair, it will be the saddest day to still have malnutrition, but never talk of malnutrition in one of the richest square miles in the province, in the country. I think that maybe you can sense that it's one of the personal issues that I also don't ever understand. The food menu, I think the MEC we approve. One of the things the MEC has instructed us to do since Afita, to standardize the menu you got better. To make sure that the menu is not subjected to interpretation, but either go store or go kitchen. Only a 7-day meal plan. Come Monday, who was so much starch, so much protein, so much. Come Tuesday, Wednesday, Thursday, and Friday. And that menu is printed and published. If only special on a menu that doesn't look right, basic, normal, only something wrong, either at the kitchen or at the supply chain. It has nothing to do with the budget, resources, or the cook. The meal plan is approved. Every 7 days, it gets adjusted. If it's not starch, it's not protein, it's not an approved meal. That you have the right to ask those hospitals why this meal does not look balanced. There will be an explanation, I can tell you. It has nothing to do with the issues around food or food availability. I think the issue here, partnership and mental health. Part of the problem I report representing. It's a summary report of a report nearly about 300 pages. So how do you summarize 300 pages? There are other things that we did not report here, like maybe in details into mental health. We as a department, depression and anxiety group, a lot of partners that are working in the mental health spaces. So the work that we do and the sharing of the plan, including the intervention, is something that we do. Last week, the matrix started doing exams. We are on a high alert because knowing the direct relationship between how people perform matric exams depending on their readiness and the issues that increase. There's crisis centers, there's other centers that deal with mental depression. We as the Department of Health cannot do it all, and that is why RETS are the partnership. But over and above that, we've invested as a province. Just last year alone, we've added over 100 new mental health care beds, new in the system that were not there before, because we are aware of, but maybe Chair, is a public education issue. We are seeing 13-year-olds and between the ages of 13 and 24-year-old people at our accident, and it doesn't matter what guy, I selective this thing, Chair. Go begin blangeni, go OD, go subokeng, go kopano. It's called drug-induced psychosis. Bana baja diritibatsi, and they become a burden to the system. As long as we don't deal with that issue, we will never have enough mental health care beds. Because they then get stuck, they must be observed, they must be treated. Some of them, they become lifetime mental health care beds. And these drugs, these substances they take amongst ourselves in the communities. And I think we have a duty as a public, as a community, to deal with that issue. We will never have enough, and then I always say, we'll never have ICU beds if we don't deal with trauma and alcohol-related injuries. We'll never have enough ambulances if we don't deal with the same. Same with mental health care beds. If we don't deal with the preventable causes, we'll never win this battle. And I think it's only fair that we take collective responsibility in dealing with that issue around mental health care. The issue underspending, I thought I've explained it. Government is a very bureaucratic thing. System of government does not allow lots of flexibility. If budget filling infrastructure, and we've got 50 million as an example, we allocated to renovate Kutzon Clinic or George Mukari. And as it happens now, Project Ela by Contesta, the contractor had to be moved off site, and. That money can't be, because George Mukari, we can't wake up, it doesn't work that way. So we must then later explain why we did not spend money more in infrastructure. There were community protests, there was a delay in planning, there was delay in municipal approval, and. So the underspending related to some of those. It is not money that we could have redirected or something else. It has to do with grant money, infrastructure money. If we don't plan, we don't deliver, we don't get municipal approval in time, we can't redirect that money somewhere else. I just thought it's something I should just clarify and explain it amongst the other issues. I think the MEC has dealt with most of the issues, including the last issue, Chair. Not every clinic can be a 24-hour facility. There's a criteria. When you say it's a 24-hour facility, you are guaranteed certain services. So if you don't have an MOU, you can't have a pharmacy, you can't have an X-ray, you can't after hours, except to receive patients and refer them somewhere at the regional or district hospital. So not all clinics can meet the criteria. 4 hour, must have a pharmacy, must have an X-ray, must have, so that when you are there, they don't just put you there and then refer you to George Mukari. There has to be certain procedures that can be done, and you can be discharged back home from there. So that is why some of the clinics, and that is those somebody mentioned in Longhore, do they not fit the criteria? It's something we can go check if they fit that criteria or not. Kelebo, thanks so much.
Maybe before HOD, I think there were two other questions. Thought maybe you can also just explain it. The second thing, there's a lady who was asking a question about hypertension. What's the treatment regime and so on? And then there was also an issue about safety in clinics. Maybe if we can, school health integration, integrated school health program, what are the collaborations there? Yeah, I think those are questions that may not have been responded to. And maybe even child health, maybe. And then the last one would be plans for some of the small clinics, which may not be able to respond to the catchment population. Are there plans
Outstanding question. Crime doesn't happen in isolation. It happens in the community. Our staff are members of recently the MEC has launched I Serve with a Smile program. And I Serve with a Smile program is that we might not always meet your needs. We might not know what is your problem, where you can help, when can you come back. You might not even get the medication that day. But somebody, what the problem is. So the campaign I Serve with a Smile to do. And it goes both ways. If you want, yes, the same courtesy must be extended. So our clinics remain the biggest cause of our security challenges. If we do not improve urgently in Soshanguve, the community, irrespective of Mombaling, protect it, including ambulances, the property, and when that is done, an outlier who is a criminal, who's trying to steal, who's to December. Somebody went into Bara Theater and broke a pipe that supplies oxygen. So it wasn't about money because that pipe is about 50, breaking what it can do. The intention is save us and we need them, including the staff. The staff that is got a better must be isolated from the rest because 90% of the staff are going diligented matter. It's based on the patient hypertension. It's both hypertension and diabetes. Only several medication treatment regimes, only the beta blockers. So it depends on the underlying cause if it's known, or it depends on the presentation and the condition of your patient. So there's a group about person's condition and the doctor's treatment, and that is why they go from high to low is also dangerous. So you measure it until you try until you get a certain dosage they're uncomfortable, and then that's why they say for chronic distribution, only those that are stable and controlled, then you can say go and come back after rated. It's mean there are issues that as basic as health education, as basic as hearing and testing and general health assessment and other. So it's about, as basic as teaching people how to ensure that kids can brush their teeth. It's part of that comprehensive program, and it's get that type of work. And communities always encourage because it's easier to teach kids at school in the presence of community. Even those that are not, then the message gets longer. It becomes too many colleagues for assistance. Kelebo.
Maolo, ager le utlwile dikarabo ager. Tsa dipotso tse le di boditseng. Ma re bontshitse re semolla molo re motlhomo o na le ba bang ba ile re ne ba sa emisa matsogo. Ager. A re batlo re le kwalle ko ntle. Re le file re re molo ka re ole. O teng sa moya ager la mona ager. Wa sutunyana e brown. So re ole le tla re motlhomo a ile re ona le ditletlebo tse ding. Tse di tsamaisanang le lenaneo la lefapha la tsa maphelo la ikopantsha le ena kere. Mara for any other thing, ne ke le file le re mo mare ke senototeane le ena o teng mo mafaratlhatlheng mo akere. So mo sebakeng sa ona nong ke batlo le leboa nna ke le modula stulo. A re utlwaneng go morago go ke batlo le leboa for maitseo le re bontshitseng ona. Since mo mosong being tolerable for utlweleng a lona for your participation. Ke ka mokgwa golomente a rona e tsamaisang mananeo a ona ka teng. Akere go tleng ha rona ka mo lefelong le a se favor. Akere it's not a favor. We are obligated or from time to time re tshwantse re tla re tlo buisana le lona. Or le lona le nne part of a decision making process. Ke yona ntho e re bitsang re re ke public participation. Akere molaotheo wa rona wa naga o le fa maatla le badudi ba province ya rona ba re phare ore golomenta e tla ka mananeo ya ona a tshebeletso le lona le ikamantshe le ona gore le kgone go fana ka tlhaetso le kgone go fana ka council ore lefapha le ka lokisa dilo yang mo le reng gona le bošaedi mo teng akere ene ke ratile ba bang ba lona ba le buile le simollotse go ntlheng la re re nana gore department e editse sentle mo lefelong le mara batla gore e itukise mo mafelong a rileng akere So rato leboa mantswe a lona mantle a lantshitseng re re a re felle ka le kasheko. Ene ke a itse ba bang ba ka nna ba re no hanga le tla mo rona. Gauteng ya rona ke re e kgolwana. So maikarabelo a rona go re tshwantse re tšhakele mafelo a farologaneng mo Gauteng. Re ka se tle fela ka mora Gauteng because ha re ka tla fela ka mora Gauteng ba bang ba ilo simolola ba complain akere. So rato le leboa ka ona mantswe ke kopile mme ke yo ba re ke mme Matshediso gore a le leboge semmuso and a re kwallele kopano wa rona akere. Motlhomo a ka latlhela lethapelo ona mo.
Dumelang baagi ba Gauteng. A ra bula le ka thapelo tje so re ka se kwale ka yona. Ne ke re ke nke sebaka ke le leboge gore ha molaetsa o tswile o fihla ko lona gore e tlang le tlo kopantsha matlo le government ya lona ya Gauteng through portfolio committee le tlile. Ra leboga mo re gatileng menwana ko teng re ile le matsogo ko metsing. Re leboge MEC siyabonga mama ukuthi mawubizwa uba umabizwa usabele. Also sibonge a team yakho led by the HOD and all the senior managers that are here. We also want to thank the support staff from the committee. Matshediso a bua ba tlo mamelo. A re ska etsang tshwere etsang. I also want to thank you, honorable members, for coming. It's our job anyway, but thank you for coming through. This shows that we all take our work very serious and are committed to ensuring that public participation does indeed happen. All our people at the back who are recording our session, you are acknowledged and thank you very much. All our support team, the guys from the media team as well, thank you very much. Re leboga le lona le re kwatetseng gore re be safe. Ra leboga le lona, we really appreciate the support. We are told that there is lunch served. Le tla ithola ko le thotseng breakfast ko teng. Ke kopa le tsamaye ka lebitso la ntate le la moya halalelang. Amen. Ke rapetse che. Guys, hona le batho ba baholo mo, ne? Let us be respectful to the elderly. Let's allow them all first to go out. Bakhono thola di packages, then the rest of us will follow. Please, thank you very much.
There's a train that comes from Namibia and Malawi. There's a train that comes from Zambia and Zimbabwe. There's a train that comes from Angola and Mozambique, from Lesotho, from Botswana, from Swaziland, from all the hinterlands of Southern and Central Africa. This train carries young and old African men who are conscripted to come and work on contract in the gold and mineral mines of Johannesburg and its surrounding metropoli. 16 hours or more a day for almost no pay. Deep, deep, deep down in the belly of the earth, when they are digging and drilling for that shiny, mighty, evasive stone, or when they dish that mishmash food into their iron plates with the iron shovel, or when they sit in their stinky, funky, filthy, flea-ridden barracks and hostels, they think about the loved ones they may never see again because they might already have been forcibly removed from where they last left them, or wantonly murdered in the dead of night by